There we go. So good afternoon, everyone who's joining us. We will continue to let people join throughout the afternoon. I'm in the background if you have any questions at all. My name's Neil Hudson-Basing. I'm the Corporate Events Manager for London South Bank University. I'm responsible for all of our kind of like corporate and profile raising events. It was really exciting to be kind of like be part of this event with Eddie and Steve, and it was an honour to be involved. We saw record numbers of people signing up to this event. I think at the moment we've had 570 sign-ups, which is phenomenal. So really fantastic that so many people wish to get involved. I'm going to take you through the Zoom functionality before I hand over to Eddie. So you'll see 3 buttons below you. One button is the chat box, which is fantastic to see you all familiarising yourself with the chat box. Use the chat box throughout the event. Feel free to say hi to people, share interesting links, useful tools in there. We'll be doing the same throughout the event. And let's really kind of keep that spirit of networking and engaging with each other, breaking down that virtual wall. The next box along is the Q&A box. And this is where we'd like you to put your questions. Please try and put them in there rather than the chat box. And that means when it comes to Q&A time, we can work through those questions as they come through. The next side along says raise your hand, and this is if you'd like to ask a live question. Not many people do this at our events, but we'd invite you to. Asking a live question means that you can ask the question, we can hear you, but we can't see you. So it doesn't matter where you're asking your question from, whether it's at your desk or curled up on the sofa with a nice hot chocolate or a cup of tea. So please feel free to use that. That's all from me. If you have any questions, please pop them in the chat box, send me a message, and I'm now going to hand over to my colleagues, Eddie and Steve. Thanks, everyone.
Thank you.
Thank you very much. Cheers.
Hi there. My name's Eddie Chaplin. I work at London South Bank University, and it's my pleasure to open up proceedings today and having a chat with Peter Cronin, initially, who was the person behind the book initially in the launch. So without further ado, we'll have a little chat together, a question and answer. Apologies if I can't answer any chat because we're on a loop. There's 4 of us in the same room and only one person has access to the technology. So we will try to keep an eye on it as we're moving around.
That's it. And I'm Peter Cronin, MP, speaking up with work for Eddie and Steve as well.
All right then, Peter. So this is all of the hard work. I don't know if people can see me.
Can I see? Complaint.
Can people see?
Hello?
No, I think Steve has been muted and disappeared. You can only see Sandra.
Oh, we can't see Steve.
There you go.
We can now.
Steve's back. Steve's back. Yeah, we can see you.
Okay.
See me?
Yeah. So this is what it's all been about. A book about COVID from the experiences of people with learning disabilities, but also friends, supporters, carers, and also a little bit from the editors. So, Pete, if I can ask you, what gave you the idea to bring up such a wonderful creation?
I think what it was. I think COVID is a terrible disease for everybody, and it's caused a lot of stress, and it's caused a lot of worries, and it's caused a lot of deaths. But it's affected people without learning disabilities, but I think it's more of a strain on people with learning disabilities because it causes a lot of anxiety and depression.
Mm. What changes has it made to your life around kind of going out or meeting people?
Well, in March, I did have a cough in March. I'm not sure whether it was COVID or what it was, sort of thing, but I did have a bad cough and a bad cold, and my girlfriend had one as well, sort of thing. So it was quite stressful. It went on from March to about nearly in the middle of April. Went on for a long time, so it could have been it, sort of thing. And it was quite stressful. I was scared to phone up 111 in case they put me in hospital. Phoned them up in the end, but it turned out all right. They just told me to stay indoors and what do they call it? Stay indoors and
isolate.
Yeah, isolate. That's the word, sort of thing. But it was quite scary. And it was sort of very nerving. And a lot of my friends found the same thing as well, very nerving and upsetting. And that's why I made this book, to try and help people.
And do you understand at the time, or still do, all the kind of guidance, what we're all supposed to do, what we can do?
No, I mean, even now, because I love Christmas and I love Christmas. I know Christmas goes well for everyone this year because it's a lovely time of year. But the scientists keep saying, oh, we've got to do that. There's going to be strict rules till next year. And it's quite, it makes me really panicky. Even last night I was panicky about it, sort of thing, because there's no clear good. The government says one thing and the science says something else. So there's no clear story, sort of thing. And as I say, it's bad enough for you guys who can read, but people learn disabilities, it's more harder. Yeah.
And what about kind of friendships going out? Have you managed to keep in touch with people?
Well, not so much. I mean, I meet people in the park sometimes. Me and my girlfriend, we meet people in the park and we go out and talk to people. But as I say, it's getting dark evenings now. It's more difficult. But we do miss the gateway. We miss the Monday club, and we miss socialising with people, sort of thing. You know, but we're trying to. I've got a tablet indoors. We've got it set up. But we're trying to get it more set up so I can speak to my friends and have communication again.
I mean, another thing we're celebrating today, as well as the book, is the Foundation for People with Learning Disabilities joining London South Bank.
Oh, that's good, yeah.
And I know you've worked with both. What do you think about that, them coming together?
That's good, that's good. That's good because it's teamwork, because it shows all us lot backing each other up. It shows teamwork and strong, and we've all got to stick together through this, even though it's a hard time. We've got to stick by each other and get through it and try and help each other as much as possible.
I mean, we've got a packed programme this afternoon. Do you want to say anything about some of the people that are going to be talking?
Yeah, there's on the screen,
yeah.
I think, yeah. Lloyd.
Yeah.
He's my best friend. Jim.
Yeah.
Christy Kirk, my top friend. And a few of the other people, a lot of my friends talking.
So we've got a nice mixture of people with learning disabilities and without learning disabilities, haven't we?
Yeah, that's it. So yes, a mixture. So and it's good that us teamwork all sticking together.
And also we've got Almudena coming from Spain, who's going to talk about what they are doing there and how COVID's done.
Yeah, that'd be
We've
nice.
also got Sir Norman Lamb.
Yeah.
Will be coming later, you know.
Yeah, that's it. Yeah.
So this has been a marathon job, and hopefully we'll get it out online by this evening.
Yeah, and I've got some positive things to say as well.
It's got a lot of positive things, and I think this is the great thing.
There's great positive things.
It's how people have coped well and adapted, and the resilience shown by people.
And the thing I want to say is that when it first happened, I didn't think I was going to get through to see September and things, because it was quite scary. Thank be that we've got through to September, and we're getting through to October. Maybe it'd be a good Christmas that we'll all have a good time together, that we keep struggling on and pushing through.
Now, my last question's here, because I know you're a busy man.
Yeah, busy every day.
Busy every day.
College, work, you name it.
What are you going to do after this? Have you got another little project lined up?
Yeah, we probably will do. As I say, me and Steve will probably get together and do something else, because we always do. We teamwork together, me and Steve and Eddie. We'll probably do another little book, because we've done a few magazines, and we'll probably do some more stuff. And it's nice working with you guys.
We're going to do one about mental capacity.
Oh yeah, we're going to do that one soon. Isn't it? So that's coming up soon.
And a poster on autism.
Autism, a little poster sort of thing. So that'd be nice, you know.
And also, I've got the other book we're doing.
Yeah. And we've done a magazine a while back, didn't we? Remember what magazine? We've done so many of them, haven't we?
Yeah, and also this conference, it's in the Nursing Times.
Yeah.
The Royal College of Occupational Therapists.
That's nice.
The Royal College of Psychiatrists. And News Shopper, I think.
News Shopper.
And also Learning Disability Practice.
Oh, yeah.
And Learning Disability Today.
That's good, yeah.
And so that covers worldwide.
Yeah, World Network.
Yeah.
Yeah. In the News Shopper, that comes out on Thursday, I think.
Yeah.
Wednesday, yeah, it's good.
Cool.
Okay, thank you. That's lovely.
Yeah.
Yeah.
And I think before as well we go, we'd like to thank everybody who's contributed, put in their hard work, whether supporting people to be interviewed or written it themselves.
Yeah, this is.
But some lovely pictures, some lovely stories.
Lovely stories.
Lovely photos.
Yeah.
And we hope that you're going to enjoy this.
And I just want to say one more positive thing before I go. I hope when all this is clear, that all we get together again and all have a chat and get together again, and when all this is gone.
Yeah, because there's a lot of things you're missing, you like the
Gateway. I miss the Gateway Club.
Friends,
yeah,
and all
I'm missing
that.
socialising and get meeting people and greeting them, you know. Yeah. It's not the same. Yeah. Thank you very much.
Peter, do you want to introduce?
Oh yeah, I'll introduce. And this is my lovely girlfriend Sandra. We've been together 4 years now. Yeah, I'll wait till the school. That's it.
And this is?
Hi, I'm Elaine. I'm the service manager for Oxleas, and I'm here to take part in a role play a little bit later. Good to see you all.
And I'm Steve Hardy, practice development nurse at Oxleas. Okay.
Okay, thank you very much, guys. Have a lovely day. I'm going to talk to you later.
So next, Neil, we've got Sandra, our clinical director of adult learning disabilities.
Hi everybody. Welcome. My name's Dr. Sandra Baum, and I'm clinical director for adults with learning disabilities at Oxleas NHS Trust. Oxleas NHS Trust covers 3 boroughs in South East London. That's Greenwich, Bexley and Bromley. And I'm talking today on behalf of Lorraine Regan, our service director, who is unable to be with us this afternoon. Many people with learning disabilities who use our services in Oxleas have been part of this book. And I would like to congratulate them and everyone else for a moving, heartwarming and inspirational book. In Oxleas, we have 2 research nets in Bromley and Greenwich. These groups are run by people with learning disabilities who are volunteers for the Trust and who help us to develop our services, and who also do community projects with the police and with other NHS services. They have shared with us their experiences of lockdown and how much work they've done to try and stay positive and to try and stay well. Members were excited to share their stories with Steve Hardy, our practice development nurse, who told them that he and others were writing a book with people from all over the world about the coronavirus and how it has affected people with learning disabilities. This book shares stories of friendship and love and how people have all helped each other. It brings out the voices of people with learning disabilities and their carers, their helpers and workers. This time has been life-changing for all of us in different ways, and we've all had to adapt to being at home more, trying to keep active whilst missing our friends, our families and our workers. This book has top tips to help others and lots of beautiful drawings and photos of all the things that make our lives rich and fun, and lovely photos of people who have been part of the book. We can see people smiling with and without their masks. It also has sad stories, and we remember people who have died due to the virus. In Oxleas, we remember John and Robin, who are in the book, and the other people with learning disabilities who have died, who have touched our lives, and we will never forget them. I am honoured and feel very privileged to be part of this book launch. As the book says, COVID-19 does not discriminate. Coronavirus can infect anyone at any age. There will be a time when we will be free of this virus, and this book will become part of our world history. It is honest and open and reminds us of how strong we can be when we are all together. We never thought we would all have to wear masks or stand away from people and not give them a hug. This book gives everyone a hug and shows at best the wonderful human spirit that we have. All of us listening to each other, connecting with each other and sharing our lives, the good and the bad things. I would lastly like to thank Steve Hardy, our practice development nurse at Oxleas NHS Trust, who has tirelessly, with his colleagues, produced a truly inspirational book in such a short period of time. We are still living through the pandemic and getting more used to reaching out to people from our own homes, like I am today. I hope you all have a wonderful afternoon from wherever you are. Thank you.
Thank you, Sandra.
Thank you, Sandra.
It's our first poll question.
Hi, everyone. What we're going to be doing through the conference is asking a number of questions. So this is a test question for you all, and it's just really to try and see what knowledge is out there, what we really know about COVID-19. So the first question, which is a test that's just to get you in the mood, is, can you have COVID-19 and show no symptoms? A, yes, or B, no?
So while people are choosing an answer, I can say something about John. I don't want to step on anybody's toes because he was mentioned in the front of the book, and I will let them allow what they said. But my memories of John was before my time at Oxley's. He moved into the bungalow, which directly backed onto our garden. So sometimes I saw him outside, sometimes I saw him on the bus. And one day I saw him on the bus and I said to him, I saw two people on your roof. What are they doing? He said, oh, they're just fixing the tiles. I said, oh, they're having a break at the moment. He says, yeah, they're just having a smoke. They're smoking wacky backy, he said. They'll probably fall off and crack their heads. Well, I tried not to laugh. But then also my other really strong memory of John is he interviews with me and everyone else. Was interviewing for a doctor at Queen Elizabeth, and a service manager walked past, who I don't remember the name. He said he recognised John. He said, I know you. He says, no, you don't. He said, no, I do, I remember you. He says, no, you don't. I've never been in hospital. He says, no, I am sure. I remember you crashed your car. He says, no, it wasn't me. So I just interrupted and said, I'm sorry, Mr. Whatever. He says he doesn't know you, so let's leave it at that. So he walks away. John turns around to me and says, it was me, and I was driving a minor Morris. And then he started laughing. He says, I didn't have a driving licence either. And by the way, this was years and years ago. So of course I was to report him if it happened today. But so that's a really kind of character he was. He always had a dry sense of humour. Was also always making us laugh. Yeah. And also to Robin, who works from Bexley Mencap, who sadly passed away. He has contributed to many groups at Bexley Mencap, but especially to the health group, and he contributed to our contribution to NHS England long-term plan. So he was really helpful speaking up for people with learning disabilities. And actually, I believe Bexley and Lewisham were the only groups in London that contributed to it. Because the advocacy group across London, they run out of time to set it up. Yeah, so well done, Bexley Mencap, and well done, Lewisham, speaking up. Thank you.
Thanks. Has everyone had time to have a go at the test question? I don't know if we've got question 1 now, or that's going to be...
I think so. I think so. We'll end polling on that one, and do you want to let's share the results? There you go.
So 99%, 96%, and that's the correct answer.
Cool. Right, shall we go to the next question?
Yeah, we'll do question 1, and then we'll...
Perfect.
Throughout the afternoon.
There you go, question 1.
So these ones are for real now. So a few more options to choose from. So number 1, what is not a symptom of COVID? A high temperature. B, a throbbing headache. C, a new continuous cough. Or D, a loss or change in sense of smell or taste.
So you have a cough and temperature, I mean.
So have a think, put down what you think is the right answer, and Neil will show us the result again once the polls.
Did you want to go through the results as they come in, or go through them all at the end, Eddie?
I think we can do them as they come in, and we can perhaps then we can get comments at the end from people.
Perfect, cool. Okay.
Hopefully, Dr. Elaine, who will be in the role play with me, you're watching and answering these questions.
Yes.
Okay.
Brilliant. Okay, cool. I'm going to end polling and then we'll launch the result.
Throbbing headache. Yes, right again, 96.
Yeah, that's right, throbbing headache.
We've got a very clued up audience so far.
And a cough. Yeah. Sweaty, sweaty.
So is it you next?
Yeah.
So next we're going to be moving on to Steve and Elaine. We're going to do a role play, and perhaps we'll move further up so Steve and Elaine can be near the camera.
Okay.
We'll move further up that way.
Okay. Thank you. I'll just do a quick introduction. An old colleague of mine who I've done loads and loads of role playing with him over the years, Sonny, or otherwise known as Justin Bieber hair flick. I haven't got any hair, but he's got lots and lots of hair anyway, so the flick. He always plays the patient, and we were really lucky for him to come in today. However, he's actually moving house, so he's got a lot on his plate at the moment. So we decided that to give him some space and time to concentrate on what's important to him. Right. Hello.
Hello, how are you? Do you have a seat?
Thank you.
What can I do for you today?
Well, you know, I've just had a cough and a high temperature. And also the main reason it affects me is I really love my curries.
Right.
There's a curry house about 30 yards from my house, and I had a korma and I didn't taste it at all. So the next day I went back and I felt, oh, I'll go for a stronger one. So I had a madras and it didn't affect me at all. So the next day I went back again and I went for a vindaloo, and I was expecting it to kick off.
Yeah.
But it didn't, I didn't taste it at all again. However, for 12 hours later the next morning, it went through the other end and it did affect me. But luckily I lost my sense of smell because I couldn't smell the effects. Yeah. Yeah, okay. So that's what's really happened.
Okay, right. So I think I'm going to have a look at you then and we'll talk more about it. But can I just mention something before we start?
Yes.
It's brilliant that you're wearing a mask today. I'm really pleased. But did you realise that you've got your mask on the wrong way?
Well, I'd like to wear the mask to protect people from coughing into my eyes.
Okay, right. When we wear masks, we need to make sure that our nose and our mouth are covered. So if you take yours off, I'll help you put it on so that you've got it on properly, so that it keeps everybody safe.
Oh, thank you.
So you need to turn it, that's right. So you see where you've got the wavy rub
Yes.
there. So that bit goes on your nose.
Yeah.
I think you're going to have to start again. So both of the strings go over your head.
Ah, okay.
That's it, perfect. And then that's it. So get it comfy on your nose. How does that feel?
It feels really good, but what if someone spits into my eyes or coughs into my eyes?
Well, you can have a thing called a visor, which is a big piece of plastic that will cover your eyes as well.
Ah.
But for most people that are just going around their daily business, the mask that you're wearing would be enough.
Oh, cool. Thank you.
So does it feel better?
Yes, it does.
Comfortable?
Yeah.
Okay.
And also, people can see me who lip read.
That's right, absolutely.
Yes.
Okay, brilliant. So let's carry on and think about now why you're here. Okay, so you've told me that you've got a cough.
Yes.
Is it a new cough?
Yes, I've only had it about 4 days.
Okay, and a temperature?
Well, I don't understand words or numbers, so I can feel my head, I feel hot, but I haven't got, what's it called?
A temperature.
Yeah, they're the thing you
a
measure.
thermometer?
Yeah, I haven't got a thermometer.
No, okay, but you're feeling a bit hot to touch. Okay, and you said that your smell and your taste isn't quite right. You've had a change.
Oh yeah, especially with the Vindaloo.
Yeah, and I think that would have affected most people, wouldn't it? Okay, so that doesn't sound very good. Okay, I'm going to have a listen to your chest.
Yep.
Okay, I'm just going to put this on your chest.
Okay.
Okay, breathe in. Okay, let's try the other side. Lovely. Listen to your back. Okay. That does sound, it's a little bit rattly, your chest. Okay, so you have got some of the symptoms of COVID-19.
Oh, I've heard about that.
Yeah, okay, and we might see those in people that we are thinking about coronavirus.
What?
When did you?
What do you mean? Have I got two diseases? COVID-19 and coronavirus? I'm going to die in the hospital.
Now it's the same thing. We call it two different names.
Well, hopefully they'll keep to one term.
Yes, I think you're right. It is confusing. I agree.
Yes.
So it's one illness, Steve, and it's got two names.
Okay.
And you will hear people call it COVID-19 and some people will call it coronavirus.
Cool.
What would you like? What do you call it? And what would you like me to say? You want to call it COVID? That's fine. Okay. When did you start to feel unwell?
About 4 or 5 days ago.
Okay. So you've been feeling good for a long time. It's taken you a long time to come and see me. That's a shame.
Yes, I was only slightly coughing at the first time, and I didn't know how hot I was, and I didn't actually notice the lost my taste until I went to the curry house.
Right.
Yeah.
Okay, so I think then we need to be sure to see what's wrong with you. So you can have a test to see whether you've got COVID or not.
So how do I have a test?
Okay, so there's two ways. So we can send a test to your house, or you can go to something called a test centre, which is a place where you go and they will test by putting a stick inside your mouth and your nose.
I think I prefer to go and have a test myself.
Okay. Well, we can talk about that after the appointment. I'll send you to the nurse and she can explain how we go around getting you to have a test. Okay. If the test comes back and you've got COVID, you're going to have to stay at home and you're going to have to isolate.
Isolate? What do you mean?
Okay, so isolate means that you mustn't go out and you mustn't have any visitors coming into your flat. How do you feel about that?
Well, it might make me go a bit mad.
Yeah, it's difficult. It's very difficult to be on your own. So there'll be some advice that we will try and help you, and we'll try and get some of your support workers to help to to do some activities.
Right.
Make sure that you've got everything that you need.
Cool.
Okay. And after your test, you have to stay at home for 10 days.
10 days.
Okay. Right. So, Steve, if you have your test and you don't have coronavirus, there's some advice. So there are some things that you need to do to keep yourself well.
Yes.
Have you been watching the television? And I think
Well,
you might know
sometimes
those
I
things.
do, but I don't understand a lot of what they talk
Okay.
about. They use really difficult words.
They do. So there's a very easy way to remember those, and it's 3 words. So the words are hands, face, and space. Okay. You think that might help you remember?
How much space?
So
'Cause I can't measure.
no, that's right. So should we go through those things? Okay, so hands, you have to wash your hands a lot. So especially when you've been touching things or you've been out and you come back home. And have you seen all the bottles of sanitizer?
Yes, in the
in
entrance
the
of every
shops.
shop.
So use that and that will keep your hands really clean. We've talked about your mask, and it's really important that you wear your mask when you go out. So if you go on the bus or in the shopping or just when you're around other people, you need to wear your mask and make sure that you wear it the right way so it's covering all of your nose and your mouth.
Cool.
And and you asked me about the distance. So the distance, when we say distance, it means that we have to keep 2 meters away from other people. And it is quite hard to just say what's 2 meters. So I always imagine it's somebody laying on the floor that's probably about the same height as you.
Yeah.
So try and imagine there's somebody laying on the floor, and that's as far as you need to keep away from the other person.
And we're near enough 2 meters.
We are.
Yeah.
We are. That's right.
Cool.
So they're the 3 really important things to try and remember. Does that sound okay? Do you understand those things?
Yes, it does. Yeah. You make it really clear.
Brilliant. That's good. Okay.
So I heard this term social bubble, and I imagine that, you ever seen the Harry Potter 5 movie?
No, I haven't.
Oh, well, I can tell you all about it. And Harry 5 movie, his horrible really annoys him, and he casts a spell on her in dinner, and she floats off. And I imagine a social bubble is if, someone's blowing bubbles, like a little kid blowing bubbles, like a really, really big bubble, and I'll jump into it, and then I think it may take me across the Atlantic, and then they're having the president election, and Mr. Trump or Dr. Trump or President Trump, if he sees me coming over, he's bound to shoot me. He's become a terrorist. So I mean, I can't understand what social bubble is.
No. I mean, it's a funny word. There's lots of new words, aren't there, that are to do with COVID, that we're all having to learn what they mean. So when we're talking about a bubble that's to do with COVID, it means that if there's a person who lives on their own, so like you, you can be friends and you can go and see people in another house. So it means that you're all together in a group. That's another word how we could describe it.
Okay. But how many people can I share? Who can come round my flat with once I'm symptom free?
In the bubble, so it can be, it's another household.
Yes.
So that means it could be a family. Who do you have?
My support workers, they come, I have them for outreach 2 hours every Monday and Wednesday, and my friends from Gateway Club.
Yeah, so it means that you can be in a bubble, so you can be in a group with people from another house. So it can't be all your friends from Gateway Club because they all live in different houses. It's just, and you have to stick with the same group of people. Okay, so whatever we need to think about to make sure that you've got enough people to help you and look after you, but still be safe.
Yes.
So that might be something that we'll need to think about a little bit more. Okay. Okay, now Steve, have you brought your black book with you today?
Yes. So have you heard of a black book?
I have. I often fill in people's black books. Yeah.
It's it's.
Do you find it helpful?
Yeah, Sharon Rodriguez. She told me it's a personal health history book. So every time I need to go to the doctors or the dentist or the optician, they fill out what happened, and then
that's right.
And if something is wrong with me, then they fill out a health action plan. Yeah,
that's good. It looks like lots of people have been filling your book in. So what should we write about in your book today?
The education you gave me.
Okay.
The tests, testing me.
So we
and
listen to your chest.
And recommending that I go for a test. Yeah.
Can you remember those 3 words that were the really good things to remember to keep yourself safe?
Space.
Yeah.
Touch.
Yeah. This is your face.
Yeah.
And your
hands.
That's right. Brilliant. So shall I write that down? Are you happy for me to write all of that down? Okay.
Well, I can take. Well, you carry on writing, but yeah, my favourite character is Spider-Man.
Is it?
Yeah.
Do you like a lot of?
Yeah. So who's your favourite Spider-Man?
I don't know anything about Spider-Man or Harry Potter. So
educate you. First Spider-Man was Tobey Maguire. The second Spider-Man was Andrew Garfield.
Yeah.
And the latest Spider-Man is Tom Holland.
Gosh.
In the first 2, Tobey Maguire and Andrew Garfield, that had nothing to do with the Marvel universe.
Okay.
But in the Tom Holland movies, it's a disadvantage because they involve other characters from the actual movies, the other like the Avengers, etc. But the advantage of Tom Holland is that he was a real teenager when they were filming.
Right.
Whereas Tobey Maguire and Andrew Garfield, they were both near their 30s. Yeah. So it's more realistic.
You know an awful lot, don't you?
Yeah.
About Spider-Man.
Yeah.
Amazing. Perhaps I should watch one of the films, do you think?
Yes, and there's 7 or 8 Harry Potter movies.
Yes, I haven't watched those either.
Oh, we should do.
Okay. I'll try and watch it. So next time you come, I can tell you a bit about what I've seen. Okay, so I've done that for you.
Thank you.
Okay, so do you remember after the appointment today, the nurse is going to see you and she's going to talk to you about the test?
Yes.
And if you've got any more questions, you can ask her.
And has she got any easy read information?
She has, but actually, before you came, I had a look because I know that your reading's not brilliant, is it? You sometimes have some problems with reading, so I found this for you. Okay, so we've got some of those leaflets printed out.
Oh, cool. Oh, that's much easier.
But you can also have a look at this on your iPad, so we'll show you how to find that on your iPad as well.
Oh,
okay,
cool.
Yeah? So that will help. It's just all the things we've talked about, but in quite nice language and with some pictures. Okay.
Oh,
is that okay? Is there anything you want to ask me today?
Well, we've got some time to have a discussion about the Marvel films.
Well, I'm really sorry, but I've got lots of people waiting outside, so I think we should we should finish now. And next time I see you, we'll talk about Harry Potter and Marvel.
Okay.
All right.
Thank you.
It's lovely to see you.
All right.
Do you remember we can't shake hands, can we? No. So instead, we can do that.
Oh, thank you.
Anyway, it's lovely to see you.
And you.
I hope you're going to be well. And if you need anything, you can ring us and we will help you.
Thank you.
Okay. Bye-bye.
Bye. All right, everyone.
Well done.
Oh, we got through it, Elaine.
You can tell why we didn't go into acting as a career.
So, has anybody got any questions about the role play we just done? Neil, have you seen any questions come up?
There's no questions about it, but there's lots of fantastic comments saying great role play. That was really good. Really enjoyed it. So yeah, lots of nice comments that people are sharing on Twitter using several hashtags. Hashtag Peter and Friends talk about COVID, and hashtag Peter and Friends. So please do continue to share those, share your thoughts about the role play. I personally thought it was brilliant. Well done.
Oh,
Well done, thank you.
Are you ready for poll question 2?
Yeah, do you want to do this one, Steve?
Yeah, go for it, Neil.
Okay, so poll question 2. So everyone, to answer, just to let you know, to answer the poll question, simply click on the answer that you think is the right one. Here we go. And I'll allow panelists to vote as well.
Elaine, this one right,
I
okay?
hope so, after my performance. Yeah.
Okay.
Okay, so for those of you that it says, before going shopping, how long should you wash your hands for? A, 20 seconds, B, 1 minute, C, 2 minutes, or D, 40 seconds?
What do you think?
40 seconds.
What about you, Sandra?
Sandra.
Sandra?
Yeah, the question.
How long?
In the morning, and he's been before he goes to sleep. The question before he goes to sleep. Yeah.
So did this help you understand me?
Yeah. Yeah.
I've got a visor, you can have it. I've got a visor for you, but also I've got another one that you can give to other people that you want to speak to.
Yeah. Yeah.
So just another few seconds to answer that. For those of you that can't see the questions, it might be that you've not got pop-ups enabled on your computer. So apologies if you're unable to answer them or see them. Are we ready for the answer? Eddie, good to go?
Yeah.
There you go. So let's share those results.
And the answer, as everyone sees, is 20 seconds, 70%. So questions are getting slightly harder. And I'm not sure if you can get happy birthday to you twice in 20 seconds.
Happy
but
birthday to you.
that was the latest government guidance.
Cool.
There you go. So we'll stop sharing those. Fantastic. That's that for now. So I believe we're now handing over to Christine, Peter, Pat, and David.
Hi, everyone. We have 4 rules. Wash your hands.
Make space.
Wear a mask. Make space. And what's number 4? Look after your mental health.
Yeah, it's very important.
Certainly is.
Thank you, everyone. Welcome. We're going to introduce ourselves first. I'll introduce everybody. There's Pat Charlesworth, who is chair of the Foundation for People with Learning Disabilities. Peter Allen, who's co-chair. David Mahon, who is the operations manager for FPLD. Nice to meet you. I'm Christine Burke. The Foundation for People with Learning Disabilities is announcing today, as part of this international event, that it has joined London South Bank University. This is an important message because we feel very excited to be part of London South Bank University. FPLD was established by the Mental Health Foundation to combat the inequalities experienced by people with learning disabilities. The Foundation for People with Learning Disability has been one of the UK's leading learning disability charities, and as part of the Mental Health Foundation has over 60 years experience in supporting people with a learning disability live their life to the full. The Foundation strives to fight stigma and discrimination, improve policies and services, and give people with a learning disability and their families the information and learning from programs. They need to lead a fuller life, more independent lives, focusing on a wide range of research and development programs. We will continue at London South Bank University to champion the rights, voice, and inclusion of people with learning disabilities. Joining LSBU gives us a huge opportunity to further develop the work of the Foundation for People with Learning Disabilities, with a focus on prevention and an asset-based lens to fight for social justice with people with learning disabilities. We'll do this by tackling inequalities, identifying what works, and by providing the right evidence, information, guidance, and support. We look forward to the future. Peter, did you want to say something?
The Foundation for People with Learning Disabilities understands how important it is to set high aspirations and encourage people with learning disabilities not to accept the boundaries that society imposes on them.
Pat?
We will continue to champion the inclusion, rights, voice and independence of people with a learning disability. We look forward to the future and working with other organisations.
David.
Okay, hi everyone. I think we all know that people with learning disabilities face greater barriers and more inequalities than most in society. And during the pandemic, this has been no different. This has had deadly consequences. Many of the contributors to the book talk about how difficult it was to access clear information about COVID-19, about what they could do to stay safe, and about what rules and regulations meant. Without the incredible efforts of learning disability organisations and local services across the country, there would have been little or no accessible information. Even then, it took these organisations time to interpret the government's information and get it out to those that needed it in easy read. During the pandemic, this delay in receiving the information can be deadly. So what we have is a group in our society of people with learning disabilities who did not have access to the right information when they needed it, who were often isolated and alone, and who appear to have been largely forgotten. Statistics are already beginning to show that people with learning disabilities have been infected by the virus far more than most in our society. From what we are learning, there's been a significant increase in deaths of people with learning disabilities this year, and much more than the general population. An early report by the Care Quality Commission indicated that there had been a 134% rise in deaths of people with learning disabilities who used registered care services in the first few months of the pandemic, compared to the same time last year. The pandemic has also had a significant effect on mental health. In any normal year, and this is certainly not a normal year, 1 in 4 people will experience a mental health issue. For people with learning disabilities, this figure is much higher. At least 4 in every 10 people with learning disabilities will experience a mental health issue. I suspect that we'll find the rates of mental ill health have increased significantly this year. Mental health services already lacking adequate. If access to mental health services becomes more limited, it's more important than ever that we support one another, that we check in on each other, and that we share the things that we do to stay well with others. Life has been tough during the pandemic, but we already need to think about how we help people to deal with their experiences. While times have been tough, the resilience of the people we work with has been incredible. So my colleagues, Pat and Peter, are going to tell you a little bit more about the challenges they've faced and how they've coped. Peter.
Well, it's important to look after your mental well-being. Don't let COVID stop you doing what you want, as long as you are safe. At first, it's uncomfortable to wear masks, but now I'm used to it. For example, the slogan, hands, face, distance, space. This slogan is important, but we need to also keep well and not be lonely. Well, keeping well, this is what I do. I keep busy, I'll read a book, go out locally, I also shop with a friend. Also have a dinner with a friend who I have a bubble with, as long as it's not bubble gum, of course. COVID makes people anxious and bored. Before COVID, things were a little different. And of course, I can't do the things I used to do. I can read or play play keyboard and watch TV, or to learn a new hobby. To also do something that takes your mind off COVID. It makes you think of something else. I like to play the keyboard. You can play the keyboard if you have one, or do double-touches like my friend Daniel. But because of social distancing rules, we use WhatsApp or Zoom, or speak to other people to break the loneliness. If you don't have WhatsApp or Zoom, a phone call is just as good. If you don't have any platform, we need staff to help you do this. Staff, please listen upskilling people, enabling them to learn how to use phones or computers to have a regular chat with different people to break the monotony or break the boredom. This is your job, and it's good for people's well-being. Loneliness is also bad for our mental health. Think about other people and you will make a big difference to their lives by just giving them a call. This is something we can all do. A walk is important. A walk is important. A change of scene is important. And being physically active helps your mental health. Staff or families should support people to keep in touch and have a connection with the outside world. Of course, we have to keep it updated, but don't listen to scary stories and don't watch things about COVID all the time, as it makes you more anxious. But as long as you follow the 3 rules: hands, face, and space, and distance, rather. And don't touch your face, particularly when touching surfaces. And look after your mental health. Pat?
We need to think of people's mental health, and people will get really lonely and isolated, and their mental health will not be as it should be. Think about doing things safely. Peter and I are living alone, and so we are in a bubble, and we meet, but still keep social distance to go out and do shopping. It's important to be careful, as we may catch the virus, or more importantly, give it to someone else. It's important to look out for people. If someone is living alone and can't have supporters coming in, and make sure they are able to do things. If staff are not able to support them with PPE, it's important, but needs to be thought about how they are stopping people doing things instead of supporting them to do things safely. The message is, don't stop people living their lives, just help them to do it safely. How important that is. Sometimes staff are authoritarian, and although they are coming from a good place, they must remember to make sure people don't get lonely. Supporting people to access phone, Zoom, WhatsApp, etc., to keep in touch with friends and family at Foundation for People with Learning Disabilities. We have a tea and chat every Tuesday, and Peter and I, as well as Christine and David, find them a good place to talk and make us feel better to link in with friends and talk about how we are feeling. So remember, there are 4 rules. Hands, and say mask, and I forgot to put my mask on, and distance. And don't forget mental health.
Thank you, everyone. Thank you very much, and thank you for listening to us. We look forward to the brighter future. Thank you.
Fantastic. I believe that we're going back to Steve and Eddie now. Thank you, everyone. And I believe we've got our next poll question. So.
Okay, that was really good from Pat, Peter, Christine, and David, and thank you.
Thank you very much, guys.
And really good of you concentrating on mental health.
So we're just waiting for the next poll question to pop up.
So our next poll question is poll question number 3. What is a support bubble? Is it A, having 6 people in your house? B, a house with only 1 adult in the home and 1 other house of any size? Or C, being able to have your friends visit? Lots of super quick respondents.
Yeah.
I think one of the big fears, we did this poll around a couple of weeks ago and was wondering would it be superseded any of the information by the different tiers we've got around the country. So if you find that what we've said or the right answer isn't right in your area, you know, please leave a message in the chat. And it'll just kind of go to show how complex some of this is remembering.
Yeah, because I thought it was 6 people because they keep changing, don't they? Somebody's 6. It's different in different areas, isn't it?
Yeah.
Yeah. Just while you're voting, I've got a bit of a promotion. It's an old book. It's a really brilliant book done by Christine and the Foundation for People with Learning Disabilities. And Peter, you're on there with Liam as well.
Yeah, me and Liam together.
And it's free to download. It's really good. All the questions you should ask about when you see your GP. Yeah, it's really, really helpful. And we use this with our mental health and learning disabilities team. Yeah. So I can't recommend that any more than that. It's absolutely brilliant. So, cool.
So just a few more moments to answer that poll. We have a couple of comments in the chat box. Just some people agreeing. I find all the different rules and changing rules very, very confusing, and I think that's the same for all of us. It's really tough for people in Wales as our guidance is different and we get mixed messages. It can get so complicated. So I think that's a feeling shared by the audience.
Because there's a lockdown in Wales as well.
For those of you that are asking for information in the book about the book, I will share that in the chat box shortly. Steve, I took that straight from your website.
Okay, cool. I can talk about the contents now if you want.
Yeah, we've got a few moments, so if you're happy to do that.
Yeah. So this is the book. It won't be this thick. It isn't. It's only printed on 1 page. Okay. Yeah. Yeah. Okay. Okay. So that's the front cover. You can download these pictures for free from
unsplash.com, which is a free to use, and most of the images we use for the easy read are from there as well, because it can get quite expensive trying to source official pictures, and they all go out of date. We all like we were in the 70s.
Yeah.
Yeah. Okay. So then, though we did this in our free time, it's really helpful. The supports from the London South Bank University, Oxleas NHS Trust, who I work for, and the Foundation for People with Learning Disabilities. Okay, and then Chapter 1. Now this is about the facts about COVID. So, there's a bit about the editors, Peter, me, Matt, Christine, and David, and Eddie. At Chapter 1, this is really important, because first of all, there's a bit by Eddie, who provides the facts about COVID.
And I think it's our own experiences really in the background. Peter starts it off.
Yeah.
Matt's got a kind of commentary of
changes
all the time, or how the situation, people weren't quite sure. And Steve's also contributed on parts about keeping well, mental health, which is also in Chapter 5 of the foundation, where they kind of go more in detail for that advice.
Yeah. And also, I'd really love to thank you for Share Communities in Clapham, Lewisham Speaking Up, and Bexley Mencap, because they were interviewed by me and Matthew, and we got so many brilliant quotes from them, and they actually made the last part of this chapter. And there's one lady, I can't remember her name, but she said something which was so, so important. She said about easy read. She says one rule doesn't suit everyone. So she recommended several different types of communicating with people. So me and Peter were talking about it. So
that's right.
Easy read.
Easy read.
Pictures.
Pictures and what's the other one?
Videos.
Videos.
Using YouTube.
Yeah, YouTube. And communicate with people more.
And audio.
Yeah, because easy read helps a lot of people. And YouTube does as well.
Yeah, so honestly, if she was up for election, I would vote for her.
Yeah.
Yeah. Cool. I remember her name now. Fatma. Yeah, good one, Fatma. Thank you. Cool.
Okay, are we ready for the results?
Yeah.
Yeah.
There we go. Let's share the results.
67. And I think some of that may reflect the different rules at different times. So I think at one time you could have 6 in the garden.
Well, this is it. Keep changing all the time. Yes.
Then they could come in your house. Then they were shut out again.
That's it.
So,
then you can meet in the pub. And you can meet in the pub.
Yeah. Or one week you meet in the pub with your friend. The next week he would have to sit on the table opposite you.
Over there. It's crazy.
But thanks, Neil. What's we got next, Steve?
Well, it's you with our Spanish colleague, Al Medina.
So Al Medina is not here just yet. If we could, would you like to go to some of the questions now that are in the chat box, in the question box to start with?
Yes, please. Yeah, go for it.
We'll get around to some of those. First question. Well, first one is, how do people cope with the COVID-19 with disabilities, and what support is there? So obviously there's the book. Where else can people find support?
From their local community learning disability team, if you live in the UK.
And GP.
Your GP. Also the charities, from the outreach teams, the supported living teams. But also, if you're feeling you've got a crisis, you can call the Samaritans, etc.
We get more and more people, but not everyone can access it. But more and more people are benefiting from online forums. It's like the tea and chat we heard from Christine and Pat earlier. But not everyone can access that. But the people who can say that they get some good benefits from it, whether it's kind of YouTube exercise classes or things. So if you're supporting someone, it's, I know Peter's just got a tablet, and having a bit of teething problems.
I'm having a bit of teething problems.
But it's good when you can, you say.
Yeah, that's right. Well, they've set it all up. I couldn't hear the people talking, or vice versa. Sometimes they can't hear me, but I'm getting set up gradually, and I'm getting there slowly. You know?
Good on you.
Yeah.
Oh, brilliant, thank you. Christine would like to answer this next question live. Is the book a free resource, Christine? Oh, you're on mute, Christine. It happens every time, don't worry.
If we're talking about the COVID book, yes, it will be free. It's free on several sites. It will be free on Steve's website, but also on LSBU and FPLD website. We've put a link already, but we will put a link in Twitter as well, and maybe send to participants when we have it. Hope that answers it, Steve.
Yeah. Also, just to say that we're making some final corrections today because there was a couple of stories that got lost on the cutting room floor, so we're just adding them, and there should be at least the first link on Steve's website by this evening.
Cool, and I shall do my very best to tweet it around the world.
Fantastic, thank you. Sarah would like to know, I know 4 people who have COVID and have a really bad headache before the other symptoms started. Has there been any other people that have reported such a symptom?
Yes, I've heard this quite a few times. That was the first symptom. People complained of a headache. Then came the cough and the high temperature. And then the last thing that happened was the loss of taste or smell. But that exactly, I agree with that lady.
And the lady on TV said she got sort of vomiting with it. Not everyone, some people. You know.
Yeah, and some people have diarrhea.
Yeah, with it, different things.
But the main symptoms are
coughing and temperature.
Coughing, temperature, and loss of senses. But also a headache, obviously, is one of the first things.
But I think it's all in 111 or whatever. That's what you did, wasn't it, Pete?
Yeah, that's right. I was scared first because they put me in hospital, but I had to do it in the end. It turned out all right in the end, but I was still nervous. You know?
It was reassuring in the end.
It was reassuring, yeah.
I mean,
it sort of helped me to relax a bit, you know.
Next question, they're actually quite linked to each other. What website is the accessible info that Elaine showed Steve, please? And is there a link to the black book mentioned in the role play? Steve, are you happy to share that?
Well, Elaine will in a minute tell you a website. The black book, if you live in Bexley, Bromley or Greenwich, you can get a hard copy from your local community learning disability team. But if you live anywhere else in the world, it's on Oxley's website. So just type in black book in the Oxley's website. So that's oxleys.nhs.uk. So you can download the whole pack.
And what we can do as well is take a list of all the resources people want and then put them in one place, the links together. So we can link to other people's sites, Oxley's or Steve's or the foundation.
Yeah.
Fantastic.
easyhealth.org.uk. That's a brilliant website of different types of information of all health issues, but especially at this time of essence, it's got loads of COVID related stuff. And also SLAM have loads of COVID stuff like Oxley's have.
The information that I showed was actually from Public Health England. I have to say though, when I looked last night, I mean, there are hundreds of easy read information. But I think the problem is keeping up with the changes about the government advice.
Yeah.
Interestingly, the easy read information is much a previous date to the rest of the guidance. So the one that I was looking at was June, and there are some things that are probably now not quite accurate. So I think you need to be careful what we're providing for people really, and think, you know, what's accurate. Lots in there though. I think if you type in easy read coronavirus, there's a huge amount of information that you can almost personalise for the person you're giving it to.
I recommend that you read Matthew's bit of chapter 1, changes day by day. So he reports about how COVID changes not only in the UK, but how it changes at different times around the world. So today, France went into 4 weeks lockdown totally. Yeah.
I tell you what, I'd like to find out more information when it's going to clear altogether. I mean, I know no one knows yet, but when it clears altogether, how they're going to get rid of it, and if the government, you know, I would love to find out more information about it, but that's more harder.
Well, I saw that on the news. They've hopefully, they think they've come up with a vaccine, so they will recommend that you have to have it twice a year, the vaccine.
Oh, yes.
And the first trial, well, they're doing the trials at the moment. If it is 100% successful, then in 6 months' time, we'll be able to be vaccinated. And people, the vulnerable people, like you're vulnerable because you've got learning disabilities. I hate to say it, I'm over 50, so I'm in the vulnerable age now. Eddie, oh, you're over 50.
Oh, I'm vulnerable on a number of levels.
Yeah.
Okay, we are now joined by Al Medina, so we're going to hand over to Eddie and Al Medina. Hi, Al Medina, welcome to this afternoon.
Hi, Neil. Hi, greetings from Spain.
Hola. How are you?
Hola.
Hi, Alma. Would you like to introduce yourself and your colleague?
Okay, great. My colleague, he's Fernando.
Hello.
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 And he works with me in our foundation in here in Madrid. It's the A La Par Foundation, where we work for the rights and participation of people with learning disabilities. And one of our, we have different areas and we have sheltered employment units. One, Fernando works with us in, he makes candies, chuches.
Yes. That's great. I know you know the English Learning Disabilities Services well, having visited us. I was wondering if you could tell us a little bit about what are the differences in Spain and what the role your foundation plays in supporting people.
Differences between the UK and Spain, or?
Yes, start with that and then talk about your foundation, how that fits into the Spanish model.
Because really, I think that nowadays in Europe, no, we, if I had to think about differences in the, maybe your model, the English model is a little bit more on the community, but Spain is also starting to be there. So really, I wouldn't notice many differences between the Spanish and the UK, I think, but.
Mm-hmm. And so, what does your foundation do, Alma?
We started working with people with learning disabilities in the 70s, and we have more or less grown with their support needs. In the 70s, we started with a special education school, and we have, as I was saying, we have grown with the needs of our clients. When they finish school in Spain, and I guess it must be similar in the UK, there were no, people finished school and they had nowhere to go, or so sheltered workshops started in Spain. So we joined the model. Then we saw that people who were there, they really could work, they wanted to work, they were willing to earn their salary and not be independent. So we started with sheltered employment units. And through that, well, then we like, when I went to visit you, because we also noticed the lack of support for people who, apart from learning disabilities, had mental health issues. So we started also working and we created units on that. Sports, we also have great sportsmen, sports as leisure, but also we have sportsmen in the Paralympic Games. Well, this year, I don't know what will happen. At Tokyo, we missed it. We hope that they will soon go to the Paralympics. We also detected the need to support victims, that I've been talking to you about this, Eddie. Victims, especially sexual abuse, but all types of abuse. We have a support unit which supports the whole process, no? From from the police up to all the justice system. Well, we have different projects. We've been growing with as I was saying at the beginning, with the different needs. Now we are with the all independent living. How is that working now in the UK? We have like more than 50 clients living in the community with supports, and trying to change also this more residential model, which also the pandemic and the COVID has already shaken. No, the residential model, we have to revisit that. And now what we are really working on is in all this independent living.
I mean, it sounds like you're spread very wide. You're doing a number of different projects. Do you get much support from the community in Madrid?
When you mean the community, you mean the government or people in the...
Local people, councils. I'm just wondering kind of where do you get your support from? Or is it a kind of struggle?
See, but you mean the economic support or in general?
Yeah, economic or in general, you know, just people.
See, more or less, what we, our foundation, half of our budget is the contracts with our government. No, they like hire you to provide services for people with learning disabilities, and the other half we generated with the different projects. Was, for example, selling the cakes with Fernando Do, or the last adventure. Now we are starting to franchise, we can say that.
Yeah, that's right.
Restaurants in Madrid, so that we are more present in the Madrid community. And we also get a lot of support. People are starting to change, no, and understand that diversity is richness, and in Madrid people are in learning disabilities is something that is being supported a lot.
Well, it sounds like a good thing. As well, you got a contract recently with postal services. Was that right as well?
Of what services?
Post services, postal? Parcels.
Ah, sí, that's very nice. It's Koiki. El proyecto de Koiki.
Yes.
Because Fernando, he also knows that project. That is a very nice project that we just started, and we deliver in our neighborhood. We deliver the last mile, what we call the last mile of the parcel service. All the parcels get, and what we have to do is to deliver the parcel in the neighborhood. And all that work is done by the workers with intellectual disabilities. So we also have that nice presence in the neighborhood where people know the foundation, know the workers, and have this real knowledge about learning disability.
I was in the UK, before we went into the crisis, we saw a lot of pictures from Spain, how terrible the time was and overloaded the hospitals. I mean, could you give us an insight to how life was like in Madrid during the worst times, and what it's like now, and what are your hopes for the future?
Sí, me preguntan, I will translate to Fernando, that que nos vieron en España con todo, ¿no? Lo mal que estaba con la crisis y todo, y la crisis sanitaria. Sí, because also, bueno, ¿le podemos decir que perdiste a tu madre? O no?
Sí, sin problema.
Sí, because Fernando was remembering, Fernando, in fact, it was afterwards he wrote the chapter, but he also lost his mother with the COVID, because she was in a residence, and so it's been really hard, mainly the lockdown, no? When we were 3 months, we couldn't go out, they were allowed only, at the beginning, nothing. After 1 month, we could only go out for 1 hour. We couldn't see the ones and one of our greatest, how do you say, worries, see, was all this independent living project, because we really were scared that people locked down and not being able to get there to see them or to visit. Well, we could have if there was an emergency, but really we shouldn't. So we started with all the WhatsApp calls and Zooms like today, and really, it really worked perfectly. And again, all the clients living independently, well, they demonstrated again that they could stand up to their dreams, no, and that the right of independent living, we cannot question it, but they really, that was, we were worried, but it was never a problem. We were more worried with the students, the school students that couldn't go out. Really, when what we work is more autonomy and to get out, to visit friends, to take the public transportation and all that. Well, we couldn't, for 3 months, we couldn't do anything except that being at home.
And it was a little bit like that here for a couple of months, and you almost kind of get paranoid when you do go out, or get a feeling of paranoia that although this virus is invisible, you're never quite sure. It takes a while to get confidence back.
Yes, and I think, no, your brain also gets the size of your room. So, no, when instead of looking at the world and moving and seeing all the capabilities, suddenly, no, and you start to think small, and then you get, no, and you don't want to get out, and see, we really saw those things happening in Spain. In June, we were able to get out, but in fact, we knew it was not real because the virus was there, nothing had changed. So no, we had a shutdown, but we knew that when we started again to do normal life, everything will come back, no, as it is happening now all around the world, no, and in Spain we are starting again to shut things and to, but we needed that moment to gain again the size of our brain and to move and to visit people, and we are back to work. We come here every morning. I don't know how long it will last, with, of course, with all the measures, and but also the mental health and we also have to look at that. So
yeah, I mean, in the UK at the moment, there's different restrictions by region depending on the count of the virus. Is it a similar in Spain? Are some areas more restricted than others?
See, because also in Spain, as you know, we have different regions, and the governor of each region decides what to do. So it's very different, but normally the cities with high density of population are the more restrictive. So Madrid this Friday will be shut down again. We won't be able to get in or out. Bars are closing now at 10 p.m. But well, you know that in Spain 10 p.m. is very early in Spain for us. So
dinner time, Steve says.
Very early.
I was wondering, have you kind of any good positive stories, or things that you kind of proud of how people have coped, or what people have done for each other during the COVID?
See, one of the things the story of Fernando, that it's in the book, and that was a nice, but what we really have been thinking about, I don't know how does it work in the UK. Here in Spain, if your business is under the lockdown, your workers can go, it's kind of an unemployment, but it's still part of the company, but they get paid by the state during the time you cannot operate with your business. I don't know, I guess you must have something similar in the UK, or?
A furlough scheme, which the government paid most of the salaries, and now they're just going over to another scheme. So it supports most workers, but there are some people, like recently self-employed, who get missed. So I think they're looking at it, but in principle, yes, it sounds similar to the Spanish.
Mm-hmm. What happened to us is that many things had to be closed, so many people had to go to this kind of unemployment. And what we had to decide is if we send to that unemployment the workers with learning disabilities, like trying to protect people we think are more vulnerable, or on the other hand, if we should keep everyone in its place and not looking at if someone had learning disability or not to take the decision. So at the end, what we did, and we think we are very proud of all the workers, is not to take the condition of learning disabilities as a criteria to decide who should or who should not go to unemployment. The selection was just made by the job you make, no? But we were tempted at the beginning, no, we have to protect them. How are they going? For example, we were talking about this parcel thing in the neighborhood, which really during the pandemic grew a lot, no? Because everything started to move with parcels. People started to buy in Amazon because they were not able to go to the shops. And we thought, what are we going to do? We take the workers with intellectual disabilities back and put workers without disabilities to move around the neighborhood in these complicated times? Or on the other hand, we leave the real workers that we had employed for that. And we took that decision. Some people didn't understand because they thought we should protect them. And we really were very, very, very proud to see how at the end, the foundation was run by the workers with learning disabilities, how they stood up to difficult times, and how none of them, the other way around, they really wanted to help, to work, to bring up again the economy. So that was really touching, and it was a story of changing your mind, how it reminded me of like in World War II, when the women started to work, because sometimes we are tempted like to put them apart, and here comes the, and we were very proud to see how the workers with learning disabilities really worked up. They had they used perfectly well all the protections, and it was very tough moments, but very, very touching.
I think what really is great to hear is the different types of work that people with learning disabilities in Spain are doing. It's not just one thing, so people are able to showcase more of their skills in different areas. Whereas sometimes we may be used to seeing people with learning disabilities in certain situations, and they're not given the opportunities to do other tasks.
See, that's true. At the beginning, that is very nice also to see the evolution, because we always thought that people with learning disabilities were only for manipulative tasks and repetitive tasks, and this stigma we hear a lot that they are really good at, they are good at what you allow them to do, So now, for example, in the foundation we have, Fernando is true that is more manipulative, but for example, all these franchises of restaurants, which in fact, we put flyers all around. You're being attended by workers with learning disabilities. No one reads the flyers, no one reads the posters, and no one really knows, the client don't know that the workers have learning disabilities, and all the places work really well. They are full of people. Also, we have this parcel delivery, or we wash cars. We make furniture. ¿Qué más naves tenemos? We make flower centers for weddings. So really we've been getting bigger all these works and demonstrating that people with learning disabilities can work almost everywhere.
Okay, I'm getting signals now that it's time to go. One of those. So, gracias, Fernando.
Fernando, ¿quieres decir algo, no?
Sí, que me encanta mucho conocerles y que les vaya todo muy bien. Por Londres.
That it's been a pleasure for him to know you and to participate in the book.
Well, it's our pleasure to have you. Yeah. It's really nice that you've taken the time, and thank you so much.
Almedina.
Steve, finish off.
Cool. Hello, Almedina.
Hi, Steve. Nice to see you.
Well, I'm sorry I had to visit because of the lockdown.
Yes.
I shall rebook it as soon as it's safe. And
you have to come soon when they let us.
Yeah.
Oh, yeah.
And also, I only know 2 words in Spanish, hola, but nadando.
Nadando, swimming.
Yeah, I take a Spanish man swimming every Friday.
Swimming.
So I say nadando to him and he goes, yeah.
It's nice to see you, Peter. Nice to see you.
Cool.
Okay, thank you very much.
Thank you very much.
It's lovely to see you both.
Have a lovely day.
Adios.
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 Perdona, creí que nos salimos.
Thank you, everyone. So thank you for Almudena and Fernando. Great to see you from Spain. We actually have a comfort break. We've got some poll questions coming up, but we'll catch up on those shortly because I know that people are probably keen for their quick 5-minute comfort break. And I know some of our speakers were as well. So we're just going to take a few minutes. Steve, Eddie, if you're happy to answer some questions while the comfort break's going on, but I just want to give the panelists a chance to take that break if that's okay.
Okay.
Shall I go to the Q&A box while that's going on?
Yeah, go for it.
Sure. So a question from Anne. I manage individual care packages and care teams. I receive no advice from local social services, councils or health organisations in different cities throughout the pandemic. Appropriate good information was very difficult to find. People with differences, disabilities and those on direct payments have been totally neglected during the pandemic. As far as I know, there is no overall organisation representing people who are cared for at home, unlike care homes and residential settings. People cared for at home need a voice. I think they need a national organisation to represent them and coordinate information and support, especially during COVID-19. I would like people's opinions about this, and if people feel that there is a need for an organisation like this, I would like to be part of setting this up. Steve, I'll invite you to respond, and Christine, if you'd also like to join in that response.
Yes, I know Anne, and I agree with her. Yeah, we definitely need an English national direct payment alliance to make sure that I'm not picking on any particular area, but some social services give much better services through direct payments than the neighbours, etc. Peter's got some examples of you've had problems getting your direct payments.
Yeah. Like sometimes, like when they changed my benefit over, sort of thing. It was a long time before I got my money through, and then I had to ask the support worker to sort it all out, and then it took months and months before I got any money.
Yeah. So yeah, I think a national alliance, perhaps with some key people like St Norman Lamb, yourself, Anne. Christine, with the Foundation for People with Learning Disabilities, other key partners, like Learning Disability England, who can speak up and be heard. Yeah, I agree with you.
Thank you. Christine?
I don't have much else to add apart from what Steve has said. We would gladly consider providing some information. And if people wanted to get together, I agree with Steve, Learning Disability England would be a good partner. And some of the organizations that are represented in this event today, like McIntyre and Voiceability and some of the other people in this speakers in this organization. So we could, I think that would be a good idea to have information that is targeted towards people with learning disabilities so that they can understand what it is they can ask for and how that can help them to have a good inclusive life. A lifestyle like no other. So it's important that I feel the information should be for people with learning disabilities so that they know how to plan for their life and what to ask for.
Exactly.
Thank you. And a question for Steve or Eddie or Christine. From your experiences, is there anything from Spain we could learn from?
Oh, yes. Almudena spent 6 months with us when we worked at Guy's Hospital. And what she said about the contract for the parcels, delivering the parcels, I've done several, and Peter's helped me, done several presentations about this. And we always use Almudena's experience of setting up and winning a tender, a contract with the local authority. And we asked the people we were teaching, do you reckon the Royal Mail would give up a tender to people with learning disabilities? And everybody answered no. I don't think it would happen in the UK.
The Royal Mail wouldn't do it.
No. Yeah. So that's a real benefit of living in Madrid and having someone like Almudena and her foundation. They do some great work there. Yeah.
Brilliant. Thank you. Christine, would you like to respond? Anything?
Yeah, I think employment is a great answer from Steve. Only 5.8% of people with learning disabilities work, whereas 95% say they want a job. And it's important that we move away from offering placements and apprenticeships and training and never resulting in a job. So we need to change our focus from all of that, instead of getting people job ready, as we see as job ready, to just support people to think what they want to do and support them in work. So that's a must. And all organizations, including the health service and the trusts that supported this book, to actually support more people with learning disabilities to be employed. That's something Eddie, David, Pat, Peter, and I are talking about in terms of London South Bank University and how we can shift things so that more people can be employed. Everybody should think about it and find a way to offer some real jobs for real money.
I think Peter's got something to say.
Yeah, I agree with Christine there, because like, I work in the co-op and I work for Steve and speaking, I'm a rep for Lewisham speaking up. And it is very hard to get jobs, because if you go in the job centre, they go, the jobs are all up there. I said, what about, I find it hard to read. We need a bit of help. A lot of my friends have said the same thing too. They need a bit of help, but sometimes the job centre just don't understand, like, you know, as they look online and things, but they forget we need help. But thank that the people with learning disabilities and the job coaches helped me to get jobs and help some of my friends to get jobs, which is really good.
You've got a really good positive attitude, because if you don't mind me mentioning, you've been made redundant from 2 jobs in the last month.
Because I had a cleaning job as well, and that's gone down over the COVID sort of thing. They're still giving us money, paying us, but I've lost my job now. They said you can go to a meeting, but there's no more work for. There's 3 guys lost their jobs with the cleaning over the COVID. So it's messed it up. So it was quite sad. Quite sad when it happened.
And what about in the cake shop?
And the cake shops, it's all shut now, sort of thing. So there's no jobs going there now, either, sort of thing. So all I've got now is a speaking up group in the co-op and the co-op sort of thing.
So hopefully we'll support you to speak to the manager so you can extend your hours.
We have some guidance on our website if people are interested specifically on employment. We have a materials called We Can Dream, What You Want to Do When You Grow Up, called WIGO, which is a curriculum to support people with learning disabilities to look at developing ideas about work. And we also have an employer's guide so that people can look at how to support employers to think about employing people, and an in-business guide, which is all around supporting people to set up their own businesses and their own enterprises. So if you wanted to look at that, just visit learningdisabilities.org.uk. Thank you.
Alternatively, move to Spain.
Yeah.
Thank you, everyone. We're now ready for our interview with Richard and Steve, I believe. Thank you. Thanks, everyone.
Okay. Thank you, Elaine.
Thank you.
See you soon. Richard, are you there?
Hello.
Hey. Hello, Richard, are you? Do you know everyone here?
Not everybody.
This is Peter Cronin.
Hi, Richard.
Hello.
Working with him for 21 years.
21 years, we've known each other a long time.
Yeah.
Oh, that's a long time. Huh?
Sandra.
Yeah. And this is a colleague of ours. We've known each other.
Yeah.
Same time, aren't we?
Same time, that's a long time now, a couple of good years.
Yeah.
We started to fight together all the time.
So, first question is non-COVID. I remember you went to Comic-Con. And what was the lady you met?
Yeah.
And what was her name? She's out of S Club.
Hannah.
Hannah. Yeah. And I went to the next Comic-Con next year. I met her boyfriend, well then boyfriend, Andrew Lee Potts.
He was in Primeval.
Yeah, they're both in Primeval. Yeah.
Yeah.
So So last question before we move on. Are you a Marvel person or a DC person?
Both.
Both?
Yeah.
Oh, cool. Good answer. Right then. So I've got some questions for you. What are your thoughts about the pandemic? And what is it about?
It's about the bug that came from China, the COVID-19.
Yeah.
It came out in December, near the end of the year, but everybody thought it was just the flu, so nobody was prepared.
Yeah, exactly. Yeah. How did you feel about or think when you had to stay at home? I mean, and how long have you stayed at home?
I've been at home since March 15th.
So you haven't been out at all?
Not for social reasons, but for medical reasons.
Okay. So how have you dealt with that? How have you done with your time?
I'm in a couple of Discords. I watch YouTube videos and I watch streaming services as well. So nothing's really changed for me because I didn't really go out before lockdown anyway. So I used to go to Queen Mary's every month on a Thursday.
Yeah, the
Surface Users Experience Group.
Yeah, I go to that meeting.
Yeah, and I go to ResearchNet every Tuesday. We do that on WebEx now. So
yes, and you've been interviewed in our new book.
Yeah, I was interviewed by Steve in the book. Yeah.
Brilliant. So also, what's your, I know you're a Netflix guy and also Amazon. So what's your favourite TV programme?
My favourite TV programme is Breaking Bad.
Oh, cool.
Yeah.
Ah.
And my other favourite TV programme is The Wire.
Oh, I haven't seen The Wire. Do you recommend it?
Pardon?
Do you recommend it?
Yeah, it's good. It's like 5 seasons, so yeah.
Cool. So it sounds as though you've been coping really well with your staying at home.
Yeah.
Is there anything that hasn't helped you going on staying and staying?
It's the confusion of the masks thing.
Okay.
Because I'm exempt from wearing a mask because of my autism.
Yeah.
Because the material is uncomfortable for me. So, and I don't want to get yelled at or beaten up for not wearing a mask. So, because that has happened before. So.
Yeah. So was that on the bus or just walking along?
No, I've just been hearing news reports about people yelling at each other for not wearing a mask. So.
Do you know from the National Autistic Society, they made cards saying I have autism and I'm exempt.
Yeah, I have that on my phone. So.
Oh, cool. Yeah.
So I can just use that for people who don't understand. Yeah.
Brilliant. Cool. So how do you keep in touch with your friends and family?
I don't really have that much family around, so I just be using the internet for my friends. Yeah. So I have an app on my phone called Discord.
And when it's our turn to do our talk, we have to press silent, okay?
So I've just been talking to my friends on Discord and we watch movies on every Sunday. So.
Cool. So you're really a technical man. I could learn loads from you on how to use a computer.
I just know the basics, so I can't unfreeze my computer. If I get the blue screen of death, I don't know how to undo that. So I just know the basics.
Well, your basics is my basics. So what are your feelings about when we came out of lockdown?
It's okay. Some commentators have been saying there's going to be a second wave and there's going to be another lockdown soon. So they've been doing some fear mongering in the press about it. So
yeah, it's happening in different parts of the UK. So
my friend in my friend in Manchester is in tier 3 lockdown now. So he's been making YouTube videos about it. So
is he a supporter of the Durham, is that his name? The mayor?
No, he doesn't like the mayor of Manchester.
Oh.
So, yeah.
Okay. So what are you looking forward to once you can leave home?
I would like to go to Speaker's Corner again because I used to go there every 2 weeks.
All right. Can you explain what you do there?
Speaker's Corner is where you have freedom of speech to say whatever you want and not get arrested.
Oh, cool. Is this all like going to Hyde Park's Corner?
Yeah, it's the same one.
Oh, really? Oh,
yeah.
Ah. So if you don't mind, can I ask one sort of thing you made, example you would say when you're at the Hyde Park Corner?
Mostly about being disabled and how it affects everyone and stuff like that. That's what I speak on when I go to Speaker's Corner.
Oh, so, cool.
Sometimes I get a crowd, sometimes I don't. So, yeah.
Brilliant. Cool. I never knew that about you.
Yeah.
That's really impressive. Okay. So, what messages from your experience could you give to other people?
I don't know. Just try and do the activities that you normally do, and try not to worry about it, or if you can, switch off the news once in a while. That's what I did.
Yeah, exactly. Okay. Yeah, because Peter was talking about watching the news every day.
It makes you really depressed, the news. It can get you down. You know what I mean?
It's very daunting at the moment. So, yeah.
Good news on it.
Yeah. Okay. So, what do you want other people to know if we have another pandemic? Well, we're having another one right now.
Yeah. Don't take it lightly. Be prepared and stuff like that. So yeah.
What lessons have been learned by the government?
None. None. So yeah.
Okay. Well, at least you're honest.
Yeah.
Okay. What's the urgent and important things that would like to see changes that help people with learning disabilities?
Just be more thoughtful of people with learning disabilities. Well, be more thoughtful for everyone, but be more thoughtful of people with learning difficulties and disabilities because they have a hard time of it anyway. So they have a difficult time because they can't go to the disabled centres or classes, or they can't see their friends at the moment because of the lockdown. So just be mindful of them.
Yeah. Peter's just started going back to college. You really missed it.
Yeah, I did. I missed Broccoli Rise a lot, sort of thing. Going back there with my girlfriend now, it's more better to get back to reality a little bit, to get back to reality.
Yeah. Okay. So let's finish on something positive. What are you looking forward to in the future?
Going back to Speaker's Corner and seeing my friends again at Speaker's Corner.
Okay. And you can write another blog with me?
Yeah. Because we're supposed to do one about Black History Month this month, but it's over in a couple of days.
Oh. Well, I can call you tomorrow.
Okay.
And I can publish it tomorrow.
Yeah. Because we was gonna do a blog about the election, but that got because they had a snap election, didn't they? So was it last year or a couple of years ago?
Last year. Last
year. Yeah.
Last November, was it? Or last?
Yeah, it was. Yeah, just
November.
before Christmas. Yeah. Okay. Cool. Oh, and also, you're the most knowledgeable person I know about American history. You know more about than anyone else.
Yeah, because I've been watching documentaries since lockdown anyway. So because I watch a lot of documentaries about Prohibition era and stuff like that, and I watch documentaries on the suffragettes and feminism as well. So yeah.
Oh, I feel another blog coming on. Yeah. We're doing the suffragettes.
Yeah.
What was the lady the really brave lady that she threw herself under the horses?
I remembered the name, but I can't. I'm going to Google it now, so sorry.
Okay, cool.
Did she get killed? Was she all right?
Yes.
Yeah, she got killed because she tried to do a banner on the horse.
Yeah. She was trying to get voted.
Emily Pankhurst.
What was that?
It was Emily Pankhurst.
Yeah, Ellie Pankhurst, yeah.
Well done, Patricia. Pat.
Thank you.
Cool. Okay. Anything else you want to say before we leave you?
Just thanks for having me, and talk's been nice.
All right, and thank you for your contribution to the book.
Okay.
So for agreeing to write a blog with me tomorrow.
Okay.
I shall send you a MS Team via email after this event is finished. So good to see you.
Okay, nice to see you.
Bye, guys.
Yeah. Take care.
Bye.
Bye.
I think you've got
Thank you. So we have we've got Norman Lamb joining us now. I believe Norman is here.
I am, if you can hear me.
Yes.
How do I start the video?
I've just
okay, right.
There you go, Norman. You're under Alison's name, but we know you're Norman. So
I answer to anything. So really lovely to talk to you all. How many people have we got involved in this discussion?
We've got about 220 signed in now.
That is wonderful. So can I first of all say that my view is that there should be no second-class citizens in our society at all. Everyone should be treated as an equal citizen, and that does not always happen, and it doesn't always happen for people who have a learning disability or for people with autism. And that's the battle that we have to continue to fight. And what I think is so massively positive about this incredible project is that it's giving a voice to people with a learning disability or who are autistic. And that is so powerful and so important. So I wanted to give a massive shout out to Peter. I think it was you, Peter.
You right?
Yeah, Peter, hello.
How are you doing? You all right? How are you?
I'm all right.
Yeah, nice
but I
see
think it, Peter, I think it was you that came up with the original idea. Is that right?
It was, yeah, definitely me come up with the idea, yeah.
Well, can I just say that you are a total star?
Oh, thank you very much. Thank you.
I'm really impressed. But thanks not only to you, Peter, but thanks to Steve, to Matthew, to Eddie, to Christine, and to David. I'm quite sure, just going through this book, that this has been a mammoth task, and to have pulled it off, to have achieved it, it is massively to your credit, all of you. So thank you all very much. And as I say, there's nothing more important than giving a voice to people with a learning disability or with autism. But giving a voice is not enough, because that voice has also got to be heard. And I wanted next to just say something about the impact of COVID. In particular, what I've read in this book, because it's useful for me to understand more about what people's experience has been. I'm very much aware that for some people, this period has been fine. You know, if you live in a nice house, if you've got plenty of space, if you've got lovely countryside, that's fine. But if you have vulnerability, if you live on your own, if you perhaps live in a group where social distancing is very difficult, if you don't really fully understand the endless complex instructions that come out from government. I don't fully understand everything we're told by the government, but I know that for many people, this has been a real worry. And if you think about things like social bubbles, what on earth does that mean? The different tiers that we've been talking about, and the R number, this is all gobbledygook for very many people. And, you know, one of the important messages coming out of this book is that the government and also other organizations like mental health trusts and the NHS more generally, we've got to communicate, talk in a language that people understand. We've got to get away from jargon that leaves so many people out of the conversation. So this book offers a really valuable service in making sure that your voice can be heard. The next point I wanted to mention is that it's also clear from this book that people have shown extraordinary resilience in coping with the pressures of the pandemic. And I applaud people who have managed to cope with it. And not only that, but have also helped others. I was struck by the contribution, the wonderful contribution from Janice about how she has done shopping for other people, helping others, even though you're worried yourself, remaining positive, however worried you might be, is a massive example to other people. And the story from Mikhail in South Africa was wonderful, reading about his hopes and his aspirations, the fact that he wants to get a Toyota Corolla and that it must be white. I love that. It's his favorite brand of car. But he talked also about how he was close to his mum. And for many of us, you know, those relationships are so important at difficult times like this. So I wanted to thank everybody who'd handed in, given their stories, to make such a rich mixture of very powerful stories for us all to read about. I also wanted to mention Paula Mcgowan, who's contributed to this book. Paula is an amazing woman. She now lives in Australia with her husband. I read about how she's close to the beach, which makes me very envious. But Paula has fought a remarkable battle following the tragic death of her son. She eventually proved that her son's death was avoidable. But I think the really important thing about Paula's amazing campaign is that something positive has come out of the tragedy of their loss, because they now have started to trial what is called Oliver McGowan's mandatory training. Oliver was her son who lost his life. And it basically means that the government has promised, we have to keep them to this, but they have promised that NHS professionals will get proper training in how to support people with a learning disability and with autism, because too often that has failed to happen. And that training, I think, will be invaluable in improving people's experience of the NHS in the future. So I think the final thing I wanted to say is just how impressed I was that this isn't just a collection of stories from our own communities, but it's a global collection of stories from around the world, including Mikhail's from South Africa. And I don't know how many people from around the world are participating today, but it's very exciting that we've heard stories from other places, other countries as well. And I loved hearing the story about the previous speaker and her contributions at Speaker's Corner. What an amazing person to hear from. So thank you very much. It's an honour, genuine honour, to have been asked to speak today at this launch. It's a massively impressive project that you've managed to pull off together. Thanks very much indeed.
Thank you ever so much.
Thank you very much.
Sir Norman Lowndes. Thank
Norman
you.
Lowndes. Thank you.
Cool.
Thank you very much.
Pleasure.
Fantastic. Thank you so much, Norman. Before we hand over to Hayley, I'd like to run through some more poll questions, if that's okay with Eddie and Steve.
Yeah, cool.
Great. So we've got question number 4. So question number 4, get ready to answer. When can't a group of more than 6 meet? Is it A, to a protest, B, for a birthday party, C, when volunteering, or D, for training?
Oh, I don't know.
I'll say for a birthday party, wouldn't it? Socialite birthday party? I'm not sure.
Ooh. What about you, Sandra?
What do you reckon? Yeah. For a birthday party, people get together.
Yeah, more people, yeah, birthday party, people then when that for the meeting, just that room. Yeah.
What about you, Ed?
I've got the answer.
Oh,
So,
you got the answer.
The panel are having I set the question.
Or training, mate. Training,
Training.
or volunteering. I wouldn't say protest.
No,
but
not protest.
But they are making big protests.
Yeah. In America, they're making big protests.
Yeah.
So we've got just a few more seconds to reply. I've got some more answers coming through now.
Maybe a protest, maybe. Maybe birthday, yeah.
Hard one.
Hard one.
Okay, and so we'll stop that one there. There you go, and we'll launch the results. There you go, Eddie, over to you.
Okay, I've lost visuals, but it's for a birthday party. You can actually still protest, organised by organisations including businesses, charities, public bodies and political parties, as long as you do a risk assessment under the Management of Health and Safety at Work Regulations 1999, and you take all reasonable steps to limit the risk of transmission of coronavirus. But it is birthday party.
Birthday.
Fantastic. Thank you very much. And so over to question, we'll do 2 now. Over to question 5.
Yes.
If you think you have COVID, how long should you stay at home for after your symptoms start? Is it A, 5 days, B, 14 days, C, 10 days, or D, 9 days? We'll give that a couple of minutes for people to answer. Wow, those answers are coming in fast.
Sometimes does this, and I don't know exactly why or how. Right, okay. Get that one as well. Yes, does that do a day's work? So do you? That's it, turn the light off.
Oh, thank you.
Oh, it's all right. Don't thank me yet. Come on.
Yay!
Okay. A few more moments to answer.
10 days.
That's your answer, is it?
Yeah, 10 days.
Peter's going with 10.
10 days.
Cool. We've still got some answers coming through.
Yeah, lovely. We've just got you back on the big screen.
So I didn't realise I was broadcasting.
There you go. A couple more answers. We're going to close polling in a second. And there you go. We will call it there. And there's the results, Eddie.
So it says from the information a couple of weeks ago, while waiting for your test or if you receive a positive diagnosis for COVID-19, you'll need to stay at home for at least 10 days from when your symptoms started. If the symptoms continue, then it will go on longer. But that's preempting some of the other questions coming up.
I thought it was 14 days as well.
Fantastic. That's the end of polling for now. We're now joined by Hayley from Downside Up. Thank you very much, Norman. Great to see you.
Thank you.
Take it over to you, Hayley and Steve, or Eddie, I believe.
Hi, Hayley.
Hello. Hello. Hi. Hi. Is it working? Can you hear us? We've got Pippi, we've got Tim the dog as well.
We can. Oh, hi. We can hear you perfectly.
Thank you so much. It's been such an interesting couple of hours joining you, listening in. So amazing to see such a great book, Steve and team. So many voices, so many different stories. It's absolutely incredible. It's lovely to see some familiar faces out there today. And I think Natty might want to do a special wave for Helen Laverty if she's there. And Lloyd. Do you want to do a hello? Yeah.
Hello.
Hi. Hi. So thank you for having us. And I think the thing that really struck me about this project, this book, is that the collecting of the stories and the putting together of it during COVID was almost as important as the end product. It was a real project to keep people going. It sort of fostered creativity and really pulled people together. So I think it's been as valuable in that sense as the end product. But I think Natty and I would like to tell you about some of the things we found tricky during COVID and lockdown, and some of the things we've actually liked, some of the positive things that have come out of it. And I think, you know, some of the things that have been hard have been being in quite a little house with no garden. That was really tricky. So we went for lots of walks, didn't we? Yeah. And got the scooter out and things like that, and took our dogs for walks. Yeah. And Natty's not been super keen on Zoom. She's joining in today, but Natty really likes doing dance. And there were dance classes on Zoom. Did you like doing that? Did you? Not really. You didn't want to join in. But do you like doing dance in real life? And it's dance classes have started up again now, and that's really great. I'm just going to put the dog down because Natty gets a little square with sellotape on the floor, coloured tape on the floor to dance in. So it's all very safe and distanced. But not wanting to join in to classes online meant that we lost contact with quite a lot of things that Natty likes doing. And she was really missing her friends. What's the name of your friend you miss the most? Is it Erin? Yeah. No. And Grandma. And it's quite tough missing your friends. Oh, you're thinking about Erin and Grandma now. It's been quite tough missing her friends. And so we did manage 1 or 2 walks where they weren't close together.
I'm so insane.
Who are you missing?
I'm so insane.
You're insane?
Yeah.
No, you're not.
No, I am.
I don't know where that word came from. And Natty was on the shielding list as well. So we were trying to be extra super careful. But we are lucky that we live in Cornwall, so we could get out for lots of walks and go to the beach and things. And a good friend of ours was in hospital with coronavirus. Well, 2 friends actually, Lloyd and another friend, pardon you. And that was quite tricky to explain and get our heads round. So we used lots of pictures and we found lots of nice little videos and stories. Dr. Rand was great for explaining about coronavirus and washing hands. And we did lots and lots of practice together. But it was quite hard for Natty to understand why she couldn't touch her face and when we went out and about. And all of those things were quite hard to understand. So we've done lots of drawings and talking about that. And I think for big sister Mia, it was hard because she missed her exams and her prom, which she was really looking forward to. And I think for Mummy, it's just been quite worrying and a bit isolating. So those are the things that we found tricky, but there have been loads of positives as well. One of the first things that's been really fab is that Lloyd, who I know is watching, has called us lots on the telephone to make sure we're okay. And we've called him and to make sure he's okay and to ask about his mum. And it's really, really great when friends check up on you and just make sure you're okay, you're not having a lonely day. So that's been great. Thank you, Lloyd, for doing that. And sometimes when it got a bit worrying, Natty found that saying a little prayer was really helpful. She's a bit tired now. And also I've dressed, she's dressed as Elsa and I've dragged her away from watching Frozen. So it's just finding things that you can do that help with your worries, isn't it? And for Natty, it was saying little prayers. I've already mentioned that we used lots of easy read stuff and pictures and videos so we could all talk about the changes. And although Natty really, really missed school, and one of the things that was difficult was that school is really different now, Natty's in a really small bubble with a different teacher. Oh, wait, my earrings got caught in your hair. Sorry. So there were lots and lots of changes, and you can't do PE and you can't meet all the same friends.
I'm shy.
You're shy? Gosh, I don't believe that. So that's strange and took a bit of getting used to. But on the other side, you're getting so much more, sort of not one-to-one, but they're in little bubbles of 8 at Natty's specialist school. So you're getting lots and lots of really quality time with the teacher. And where do you have lunch? Do you go to the lunch hall for lunch? No, you don't. Where do you go? Lunch is in the classroom. So it's almost like having a picnic lunch every single day. I don't know. Natty's telling me something, sorry. Natty feels. How do you feel, Natty? Oh, she's got a sore throat. And I think Natty seems to have a sore throat every morning. So I think sometimes the more we talk about all these symptoms and what we're watching out for, we all start to think that we might have a sore throat, don't we? Am I hot? You know, that sort of thing. So school has been really good in a way, and it's a bit less stressful. And we did lots of fun school at home, which was really nice for Mummy to do some stuff with Natty again at home. And I think Natty is a bit more relaxed than she was when we were dashing about doing lots of after school activities and school was really busy and everybody was in the dining hall and out in the playground. I think she's actually really benefiting from a slightly quieter life. And you feel dizzy. Gosh, she's feeling dizzy now as well. And little things like sleeping better and not having little stammer that Natty had has gone since COVID. So that's been a really positive thing. So we've done lots of fun. We've started doing stuff outside the house again. We've been to the cinema a couple of times and we've been swimming, and it feels really safe to do that. So we were the only people in the cinema the other day. So there is hope for us all. We are going to be able to go out and do fun things again. And we've just got to keep looking out for our friends and staying positive and keeping safe. And I can't wait for this book to go out into the world and educate other people a little bit more and create even more change. So thank you all so much for what you've done, all the really hard work you've put in. And thank you for having us. Sorry, Natty isn't being very chatty today, but it's because she doesn't really like online stuff. So thank you so much for having us.
Thank you. Thank you, Hayley.
Thank you.
Thank you, Amy.
Thank you so much. Lloyd, I'm just gonna ask if you want to come and say hi, if you'd like to.
Oh, that'd be great. There's Lloyd.
There you go.
Hi, Lloyd. Thank you for being such an amazing friend.
Oh, you're making me cry. Oh, thank you, Hayley.
You're the best man.
Oh, Natty says you're the best man.
Oh, thank you, Natty.
You're welcome.
Oh, Hayley, how's Mia?
Mia's okay. She's got a little bit of a cold, and she's resting in bed. So we're all just having a quiet half term. But maybe we'll ring you later and have a really good catch up. It's lovely to see you though. In real.
Shall I give you a ring later?
Let's do that.
Later. All right then.
Oh, it's great to see you.
Thank you for joining us, Hayley. Thank you for joining us, Hayley. Nice to see you.
Nice to see you all. It's been really, really great. It's been like we feel like we're with you. We feel like we're in the room. It's been a lovely, lovely experience today.
Cool. Well, what time shall I give you a ring, Hayley?
Oh, whenever you're free. We're not going anywhere.
All right then. I'll give you a ring. I'll give you a ring after this meeting.
Perfect. Thanks, guys.
Thank you, Hayley and Natty, for joining us. We're going to go to two more quick poll questions before we move on. We've got question number 6. If you live with someone with COVID, how long do you need to self-isolate for? So that's if you live with someone with COVID. We've got A, 5 days, B, 14 days, C, 10 days, or D, 9 days.
14 days.
Oh, yeah.
Lots of answers coming through fast.
Yeah,
Few more moments to answer. Give you a couple more moments. I'm not even sure I know this one.
I think it's 14 days. Not sure.
Last moment for answers. There you go. We'll call it there. I'm going to share the results. Eddie, over to you.
Right, this one's right. This is the 14 days one, which people may have got confused with in the last question. So you must self-isolate for 14 days if you live with or in a support bubble with someone who has symptoms of coronavirus and tested positive, had an unclear result or did not have it, or tested positive has not had symptoms. So that's the bump around that one. We're going to have one more question, Neil.
We have got time for one more question. So we're going to go for question 7. And there it is. How long do you have to keep self-isolating if you still have a high temperature? So that's how long do you have to keep self-isolating if you still have a high temperature? And I've got A, 24 hours, B, 48 hours, C, 60 hours, or D, 72 hours.
40 hours? Not sure. What do you reckon? 40 hours?
that's good.
I say 40 hours. I'm not sure now.
Give it a few more moments to answer that one. We're joined by a Matt. Hi, Matt. Your video is loaded and ready to go.
Thank you, Neil.
About 5 minutes before we play the video.
Great. So a few more moments to answer that last one. There you go. We'll call it there. There you go, Eddie. Over to you.
Okay, I saw one of the comments up, but it's more difficult to understand in hours. But that's how the government puts it rather than us putting the question. So that's something to kind of think about when we're communicating with people about days. but it's you'll need to stay at home for at least 10 days from when your symptoms started, and then still self-isolate for another 48 hours is the guidance. But saying that, if you're still after 48 hours at a high temperature, then I would imagine you would still self-isolate. That was the current guidance.
Oh.
I'll hand over now to Steve now. Neil will talk to Matthew.
Hi, Matt.
Hi, Steve. How are you?
Doing really well.
Hello, Matt.
Hello. Thank you very much for having me here with you today.
Well, we owe you a massive thank you for the video. About your video.
Oh, sorry, Steve, we can't see you.
Oh, sorry.
You can move over slightly because we can't see you. We can just hear your voice.
Okay. Whoa.
That's better. Thank you.
Okay, cool. Right. So I've got some facts. I'm not very good at technology, so I couldn't actually make a clip from YouTube. So I actually had to film it from my camera. Okay. I can't have access to how many people it reached through other people, but it reached probably 527,000. That was by Sally Phillips, Joe Wiley, Sir Norman Lamb. The actual personal reach from me, from my Facebook and my Twitter, 7,500 people reached it, and then actually 5,400 people actually watched your clip. So I imagine that it will probably be in the tens of thousands. So hopefully, when you put it up live, if I can put it on my website and put it on the foundation as well, your YouTube, it will get all the hits. So congratulations.
Thank you very much. No, we just we hope to provide a little bit of light relief. I know we've had a lot of amazing speakers on today, and following on from Hayley and Natty is not an easy task. But yeah, we just thought we'd provide a little bit of a break from the talking and a bit of music to make the situation seem a bit more bearable.
And can you explain the reason you picked this song?
Yeah, so I'm part of a choir. I'm a student at Cardiff University, and this is a group that I sing with on a regular basis. We went to a competition last year, and this year everything's a bit different because we can't meet face to face or do any of the rehearsals like we normally do. So we've had to learn how to do it all online, and this was one of the songs that we learnt last year, but it was the first song that we've learnt together online. And so that's it's great to be able to still sing with people, even though you can't be in the same room. And one of the big challenges is when you're all in the same room, you can see what everyone else is doing. Unfortunately, in this version of reality, you can't see what everyone's doing. So I got a little bit more overexcited than some of the other people in the choir. So yeah, apologies for that. But no, I do really enjoy the singing, and it's great how the group have adapted to still be able to get together, even though we can't meet face to face.
It's really great, and you don't have to explain. You're really positive in the video, and you made people feel really happy. Atlas House, I betted you had 5 cans of Red Bull. Said something else, but we won't go into that. You really made a good impression, especially that lady in the middle.
Yeah, that's Ruthie Cooper, who's our soloist on that song.
Oh, cool. We've got a box of alcohol. I won't send it. I'll send it to your address in Wales. If someone's still living there.
Yeah, they'll be there.
Okay, so I'll tell him or her that they shouldn't touch it. It's for you. Quiet. Okay. Right. So, do you want to introduce the song?
Sure. Yeah, I can do. So The next song that we're going to play is from Cardiff University Vox, and the song is called Castles by Freya Ridings.
Thank you.
Thanks.
Just to let you all know, if there is any jumping at all, which occasionally does happen when sharing videos over Zoom, we will pop the YouTube link in the inbox so that you can watch it later. Hopefully there won't be any lagging right now, but just in case there is, we'll share that YouTube link with you.
Cool.
2 seconds.
You got that rush and then you walk out the door. You kept me as small as what you wanted. I never noticed. You held my hand into the darkness. I didn't care, it just made me want you more. My God, your love, it seems so harmless. I never noticed. And I hate that you're gone, and I hate that I don't want to let you go. And I hate that you think that I'm weak, 'cause I don't want to let you know. I'm gonna build castles from the rubble of your love, from the rubble of your love. I'm gonna be more than you ever thought I was, you ever thought I was. Whoa. Each time you left, there was a hunger. I felt so dead, I couldn't take anymore. Losing your love and left me stronger. I never noticed. And I hate that you're gone, and I hate that I don't want to let you go. And I hate that you think that I'm weak, 'cause I don't want to let you know. I'm gonna build castles from the rubble of your love, from the rubble of your love. I'm gonna be more than you ever thought I was, you ever thought I was. I'm gonna build castles from the rubble of your love, from the rubble of your love. I'm gonna be more than you ever thought I was, you ever thought I was. Whoa. Castles from the rubble of your love, from the rubble of your love. I'm gonna be more than you ever thought I was, you ever thought I was.
Brilliant. Well done, Matt.
Well done, Matt.
Absolute star. Cool. Right, so Neil, we've got a poll question now, have we?
We do. 2 seconds. Let's find those poll questions. So this is poll question 8.
Okay.
Do I need to keep self-isolating if I still have a cough after 10 days? A, I don't have to isolate anymore. B, I have to isolate until the cough goes. C, be safe and wait 48 hours. And D, once my doctor says it's okay.
I'll say it's not safe to wait, the cough's gone, really.
Yeah. Oh, I don't know.
Yeah. Because if you still go out there and you've got a cough, you could still spread it, innit? It's all cool. I don't know. It's all cool how bad the cough is, I suppose. It's a difficult one.
Yeah, 'cause you might infect other people.
Yeah, well, yeah.
Even a mask,
yeah,
sometimes doesn't give
no.
you 100%.
It's still be in your system, you know what I mean?
Yeah.
What do you think?
Yeah. Mm.
Give a few more moments to answer. There's a few people still to answer.
You should be the new Minister of Health.
Yeah.
Replace old Matt Hancock.
I'll be on it tonight.
Yeah.
I said, Boris Johnson.
There we go, a few more moments. And I've just shared a link to Matt's song in the chat box for those of you that are still smiling from it and would like to listen to it again shortly. We'll end polling there. Eddie, over to you.
Well, the answer on the Government Public Health England website was you don't have to isolate anymore. And the reason they give for this is that a cough or the sense of taste sometimes will last for several weeks after you're infectious, after you're no longer infectious. So it's once you've done your 10 days, you should be okay not to isolate, even if you're still coughing or still showing those two symptoms.
That's good. Yeah. Still got it.
Cool.
Okay.
So, our new superstars are up. I believe Lloyd and Jim are up next. They've got a really, really good story to tell you all of. And thankfully, it's got a happy ending. So over to you, Jim and Lloyd.
Hi, Lloyd. Hello, everyone.
Hi, Jim. You all right?
Yeah, not bad, mate. How are you today?
Yeah, fine, mate.
Yeah, I'm okay. I'm okay, yeah.
Yeah? You got your blue headphones on?
Yep.
Oh, dear. They haven't got Chelsea on them, have they?
I was going to put Chelsea on them, but I'm not going to.
See, that's the biggest problem in life, isn't it? So,
yeah.
Lloyd, we're going to talk about some time around April time. Do you remember?
We were, yes.
What are we going to share with people today?
We were going to share about me getting COVID-19 and how I got to hospital.
Yeah. So do you remember, we speak most days, don't we, you and I?
We do.
And we often talk about lots of things, and we often have a bit of a joke and a laugh together. We've known each other for about 25 years, haven't we?
We have.
Yeah. And so when we chat, we know what each other's up to, really, don't we? But during April and beginning of March, mid-March time into April,
yeah,
you weren't your normal self, were you?
No, I was really quite ill, and because my brother saw me in the chair,
mm-hmm.
and he saw a nasty infection on my leg.
Yeah.
He took me to hospital to get me checked out, and I was there for over a week.
Yeah, you were there for nearly a couple of weeks, I think, at the time, weren't you? But if we go back a little bit, Lloyd, do you remember when we were having our conversations on the phone?
Yeah.
And you know, like you're a chatty bloke and you love your jokes and everything.
Oh yeah.
Yeah. Well, you weren't very jokey and very scared and worried, weren't you, because of what was happening on the news?
Yeah.
And do you remember Ray and I told you that maybe you better just watch one program a day about the news, and if you're worried about it, you talk to me or Ray. Ray's your brother, just so that people know who Ray is. Yeah. And also, you didn't really want to speak on the phone, did you?
No, not at that time. I didn't.
No, and you weren't really answering questions very well. You weren't really. It was hard to understand what you were saying a lot of the time, and it wasn't.
I'm chatty now, Jim, but look at me now.
Well, look at you now. Exactly, you're back to your
now.
normal self now, but you weren't your normal self then. So, do you remember the conversations? Well, Ray and I had, because I rang Ray, didn't I? And I said I was worried about how you've been.
Yeah.
And we both thought that you might be a bit depressed, but you've never had a history of being depressed.
No.
Mentally unwell. So we thought that was a bit strange. And then you're right. The bit about so we thought about maybe getting your mental health checked out, didn't we?
Yeah.
Because we were worried about that. Then Ray saw your leg.
Leg.
Yeah, the sore on your leg.
Yeah.
And then I had a chat with Ray, and we said about you going into hospital, didn't we, to get it checked out? You went to A&E.
Yeah.
Do you remember when you were in A&E? What did they say to you? Do you remember?
Well, they put me. Well, first of all, they put me in a room in isolation, so I couldn't chat to anybody.
Yeah.
And then that's for a couple of days. Then they moved me to another ward. Then I went into Elm ward.
Yeah. But before that, Lloyd, you know when you first went in with Ray and you were in for your leg?
Yeah.
You thought you didn't really need to bother about going in for your leg, did you?
Yeah.
Yeah, it was only because sort of Ray said that you really needed to go in because he was really worried about it. The sore wasn't very good, was it?
No.
So when you were in A&E,
but the district nurses come in every Tuesday.
That was after. That's when you came out of hospital.
Yeah.
Remember? But when you were in accidents and emergency.
Yeah.
You remember they looked at your they listened to your chest, didn't they?
Yeah, and when I went for an X-ray.
Yeah. And at that point, they thought you had, they said that you had COVID.
Yep.
Were you told you had COVID at the time?
No, I didn't. No,
you weren't told. Do you know why you weren't told?
Because I think you and my brother Raymond kept it a secret.
Yeah.
From me.
We did. We did keep it a secret from you. Do you think that was
that was very, very kind of you.
Yeah, it was. And we did that, Lloyd, because we both know you very well. And you weren't.
I know you exceptionally well, Jim.
Yeah, we do. We know each other very well. Too well at times, I think.
Did you? About 25 years of it, I think, Jim.
It has, hasn't it? It's been a great time. But at that point, Lloyd,
yeah,
I was worried. Ray rang me from A&E, and he said that he didn't want to tell you. What did I think about it? And I said, I don't think you should tell him. And we agreed not to, because you didn't really understand that you were unwell. You didn't really worry about your leg, which was really bad. And you also weren't worried about your chest. And you weren't your usual self for a good few, a week or two before, really. So we thought that you didn't really understand what was happening. So that's something like the Mental Capacity Act that I thought that you couldn't understand or know what was good or bad about going into hospital. And that if we told you, you would go onto a ward by yourself. As you said, you went into isolation. And what would have happened then? Because we couldn't go, could we? Ray and I couldn't go. We couldn't visit you.
I'll tell you what, Jim, definitely not.
No.
Definitely not.
It would have been very scary, wouldn't it?
It would, yeah.
So, do you remember what we did after that? We made contact with the learning disability nurse there. Do you remember who the learning disability nurse was?
Yeah. I knew what a learning disability nurse was until I started working with you, Jim.
Yeah, but the guy, who's the person that went to see you in the hospital, the learning disability?
Oh, that was Lee Moore.
Lee Moore. So
Lee Moore.
Ray and I had a chat with Lee, didn't we?
Yeah.
And we also said about not letting you know because you'd get so worried about it.
Yeah.
And we then told people not to let you know, but you had the phone near you, didn't you? So we'd speak to you every day, didn't we?
You did.
Yeah. So when you came out of hospital,
yeah,
And you talked about, you know, when you had to get your chest done again.
Yeah, I did. That was
When
in
did you find
June.
out you'd had COVID?
That was June. That was June. I went.
Yeah. Yeah, that was June because you had to stay. You had to wait a month, didn't you, before you had your test again?
Yeah.
Your chest. Yeah.
Yeah.
And that's when they told you had COVID.
Yes.
Yeah.
Well,
and how did
well,
you?
I'm got it now, Jim.
You haven't got it now.
Because I'm busy. I'm busy all the blinking time.
You know, sometimes we don't understand what's happening for us, and sometimes people have to act in somebody's best interests.
Like the Mental Capacity Act.
That's right. So
Yes.
what Ray and I did with the team around you was act in your best interests, because you didn't really understand what was happening for you, and it would have only caused you a lot of stress, and you'd have been very scared and frightened.
Oh, yeah.
So when you first were told you had COVID, do you remember with that appointment with Ray? What did you think?
I really thought it went. I thought it went down well.
Yeah.
Went down
And
well.
then we spoke about how we're going to help other people like yourself who've got learning disability, who've had COVID.
Yeah,
And
like
that's how we got involved in this book.
Yeah.
Yeah. So Lloyd.
Yes, Jim.
Oh dear, mate. Oh,
Jim, you're funny.
Well, I'm not as funny as you, mate.
I'll tell a joke to you later.
Yeah, you can tell a joke at the end of this. I could feel you were brewing it.
Yeah.
So what would be your message for other people that don't understand what's happening?
What?
You know, like when you were unwell with COVID,
Yeah.
you know that Ray and I didn't tell you.
Yeah.
You know, so it's all people always say it's good to know, but in your case, it wouldn't have been good to know, would it?
No, it wouldn't, would it?
So the point is,
I'm very glad you didn't, Jim.
Yeah. And that's why it's important that everybody has people that know them well involved in their care. And that is one of the biggest things that I think came out of this for myself and Ray, was that Ray wasn't on his own, because your mum is quite elderly, isn't she, Lloyd? And she gets worried quite a lot. So
yeah, she's 87, Jim.
Yeah, she needs quite a lot. She's 87. She's fabulous, but she needs a bit of help herself.
She
doesn't
is.
she?
Yeah.
Ray and I did a lot of the stuff together, didn't we?
Yeah.
And Ray's also said that he wants to do some talking about this as well, and how having a brother like you, being Lloyd, is just you're Lloyd. And he said to me yesterday that when I spoke to him about getting involved in doing some work about being a brother of someone with a learning disability, he goes, well, I don't really see Lloyd's learning disability. He's just Lloyd. That's just part of him. And he said, all of my friends, we've just grown up with Lloyd being how he is. And he said, the biggest problem is you support Chelsea. So we had a laugh at that.
Yeah.
It's quite right.
I've supported Chelsea all my life, Jim.
I think we've come to the end, and I know that you're desperate for that joke. So go on, lay it on us.
So, what did the duck say when he bought lipstick?
I don't know. What did a duck say when it had bought lipstick?
He said, "Put it on my bill."
Oh. Lloyd, is there anything else you want to say before we finish?
No, I'd like to say thank you to you and Steve and Neil and Hayley and Natty for being such wonderful friends, and everyone around me. Thank you very much.
Likewise, I completely agree, Lloyd. It's fabulous. Thank you, everyone.
Thank you, everyone.
Thank you, Lloyd. Thank you, Jim. That was brilliant. Stephen, Eddie, you're such a brilliant double act. It's amazing.
We're a double act, Neil.
Well,
you are.
It's a hello from me.
And hello from me as well.
Lots of cracking comments in the chat box. Thank you both. That was fantastic. Brilliant, Lloyd and Jim.
Mary.
Thanks for sharing. Lots of positive comments. So do have a look through those. Steve and Eddie, are we ready for our next set of polls?
Yeah.
Yeah, can I just quickly say a big, massive thank you to Lloyd and Jim.
Yeah, thank you, Lloyd.
Chelsea and West Ham, they're right down in the worst in London, because Charlton and Arsenal.
Oh, go away.
What can we do? You know, Eddie supports Palace, you support Charlton. There's just no hope for some people.
Eddie?
Yeah, right.
There's no hope for you at all, I tell ya.
Oh, won't do Ronaldo anymore with you.
No. Fish and chips.
Right.
Oh,
glass bottle.
Eddie.
Yes, mate.
I remember I came up to London South Bank with Jim.
Yeah, that's right.
And we met there, didn't we?
Yeah. And you come up with Jim and Christine as well another time. You've been up a few times, haven't you?
Yeah. I've been up a few times to the London South Bank.
Yeah. It's up the elephant and round the castle.
Yeah. They sent me and Lloyd out.
See you later, Lloyd. See you later, Jim.
Oh, Steve.
Yeah. I'll see you tomorrow, Lloyd, about 5 o'clock.
Yeah. Can I come in your come on? Can I come join your party tomorrow?
Party?
Your Black History Month party?
I'll have to check with the manager.
All right then. Is that Kay?
I don't think we're allowed visitors, I'm afraid, but I'll double check. But at the moment, I don't think we can say yes. If we're only allowing the staff and the people with learning disabilities that live there.
All right. Don't worry then, Steve. I'll speak to you tomorrow.
I'll take a video of it for you.
Lovely.
I'll show you the video of me and the main man doing a presentation about Somalia, and then doing something really embarrassing. We're going to be dancing to some Somalian music in front of everyone.
Oh, Steve, when is the book published?
Tonight.
Oh, and I'll probably get a copy to you. And I'll probably get a copy from you tomorrow then.
No, just the electronic version comes out first. We're just finishing it off today. So it's going to go on the website, and then Eddie's going to get it printed. It costs about £2,000 for just out of 100 copies. So you and Lloyd, Jim, Hayley, etc., everyone that helped out and presented today will get a copy.
We're trying to get the cheapest price with a good value product, just so we can get as quickly as possible.
Okay, then, Steve. I'll speak to you tomorrow at 5 o'clock then.
Yeah, I'll see you tomorrow. Cool.
See you tomorrow. Yeah.
Thank you, everyone. So, ready for question 9.
Question number 9.
How long does the virus survive on surfaces? A, it is different for different surfaces.
Oh, God.
B, the virus dies after 2 hours. C, the virus cannot stick to surfaces. D, the virus dies after 6 hours.
I'll tell you what does kill the virus. They call it bleach. If you put bleach on a thing, it kills it. But I'm not sure it lasts before that. But I know bleach kills it.
You've been listening to Donald Trump.
No, the news told me. No, Donald Trump said drink it.
I wish he had.
Let's definitely not try that at home.
No, oh, sorry.
I think
so. We'll give a few more moments.
What do you think, Steve? What long?
48 hours, I think. Oh, it's different for different surfaces, probably.
Yeah, different for different areas, I suppose, isn't it?
it might be different from an envelope to the table to the plastic bag.
That's it, all that or anything, isn't it?
Yeah.
What do you think protection lasts? How long do you think?
Yeah.
Virus.
Yeah.
I'd like to thank Richard in the chat there for reminding everyone not to drink bleach.
Yeah, don't follow President Trump.
I know some people can take what people say seriously when it's a joke. So what Richard said, don't drink.
Yeah, don't drink it. Don't listen to President Trump.
And
Boris Johnson either.
Don't inject it either.
He said that as well.
Yeah.
Or don't listen to Boris Johnson either.
Are we nearly ready for the?
Right, sorry about that, everyone. Okay, yep, got loads of answers. There you go. Over to you, Eddie.
I can only see, I've got it up now. Yeah, that's all right. It's different for different surfaces. On some surfaces, the virus remained detectable for up to 10 hours to 3 days, but it gets smaller at the surface area. And the shortest life was on copper and the longest on plastic. So it is variable what the different surfaces are. What have we got next now, Steve?
I think now we have, we've got another poll question, have we? Is that the last poll question?
We've got one more poll question.
Oh, one more poll. There we go.
There are questions from...
So question 10, during self-isolation, I can use only taxis to go out, B, go outside in my own garden, C, invite only 6 people into my home, and D, share cutlery.
Ooh. Well, you can go outside in your own car.
Yeah.
Well, I can't drive, but...
Well, go in your garden, can you?
I got a taxi yesterday.
Yeah. Yeah, because a lot of people are getting taxis and things, aren't they, and stuff, aren't they?
Yeah, the black cabs.
Yeah.
They're really safe because they got the plastic visors across, and they only got a little gap where you put the money in.
Oh yeah, it keeps you safe from the virus.
I don't know about private taxi companies.
No.
At least they'd wear a mask and we'd have to wear a mask.
I'll tell you where it's more unsafe on buses, I think, because it's more open.
Yes. Yeah. And I reckon some bus drivers, they ignore the maximum number.
They just let more on.
Especially about 3:30 when they let the schools out. So all the kids, everyone was sitting down. Yeah. And there's loads of people standing up as well.
There we go. Right, are we ready?
Yeah.
Got most of our answers in. There we go.
And that's right. Everyone knows that. It's a very lonely existence. You can only go outside in your own garden.
Yeah,
and even then, you're still isolating from people as well. And I'll leave it over now to you, Neil, if there's any questions.
Yes.
Okay, so yes, Q&A time. Please feel free to pop your questions in the Q&A box. Sorry for the technical issue there. I got kicked off and I was worried that the whole event had collapsed, but we're still here. The wonder of live virtual events. The fear was real. So we have a question from Anne in the inbox first, but please pop your questions in there, and we will go over to the live questions to the people that have raised their hands. So Anne asks, friendships between people like Eddie and Lloyd are precious and priceless. I have been involved in training befrienders for the National Autistic Society. For more formal care, I would like to see a recognised basic training programme. I will give a basic example. For instance, care agencies have sent carers out to one of my clients who wears hearing aids, but the carer doesn't know how to assist clients putting their hearing aids in. I provide bespoke training to all of the carers I employ on behalf of clients. I think there should be basic training and then ongoing and more specialised training for carers. This could also lead to some career progression. What do people think?
Well, I used to be a befriender to a young man. He was 18 years old and I was in about 25. And I had to do 2 evenings of training, so about 6 hours in total. So I learnt about some simple Makaton, epilepsy, how to communicate with people, exactly what a learning disability is, etc. Yeah. So I recommend the same as what Anne believes. All befriending schemes need training.
Yeah, and I think it's the same with new people. When you're meeting someone for the first time, it's really to getting to know their needs. I think sometimes we take for granted that people are more able in certain areas or less able in areas, when it's totally not the case. I think we should really kind of start with that blank sheet and ways of kind of trying to know the person more before we start going down the.
I agree with Eddie, because some people think you're more independent, and you can be independent in some ways, but you need help in other ways.
Our director of Learning Disability Services, and also at Bromley, she was a befriender as well, same time as me, but it's different from borough to borough. So when I did it in Greenwich, Greenwich supplied the self-advocacy group to train us, but perhaps in Lewisham, you might not, I'm not sure, but it really does differ across the country.
Thank you. And our audience will notice that I've actually invited all of our speakers back onto the screen. So there's a nice kind of colourful screen of everyone's faces. So I'd like to open that question up, actually, if anyone else would like to answer it.
I think it's a great question. I think for me, it's about seeing the person and tuning into who they are and their frequency. And the delight for me is Lloyd's I've never actually worked with Lloyd. He's never been a patient or he's never used a service in which I've been involved in. So we've just been friends all the time. But the real pleasure for me is those many people that I have been their nurse for and their families have then gone on to become friends of mine. And I think that's really, it's one of those things that it happens after you've worked with somebody for a period of time and don't work with them anymore. And I think also what's really great is to sort of just have a laugh, really. I mean, just see who they are, what do they like, what do they don't like. I mean, the similarities for Lloyd and I, we like the same sort of music. We've got pretty much the same sort of sense of humour. And he took great delight in coming to watch West Ham lose last year, which, disgusting, really. Why I gave him a ticket, I've got no idea.
Yeah, because you lost to Man City 5-0.
Richard, you had your hand up.
This has been very helpful because I've only started using the service since 2015. So even though I asked for help like back in 2001, there wasn't that much help with people with learning disabilities back then. But there's much more help now. So I've just been starting to use the service recently.
But you're such a star. You're much more of a benefit in Oxleas. You're really put into service user experience meetings, writing the blogs with me. You go the extra mile, Richard.
I do a lot of volunteer work for Oxleas as well. So because of the pandemic, it kind of set me back with my anxiety a little bit. So I was doing well before the pandemic, but then the pandemic hit. So.
Me and Peter, we joined ResearchNet in Market Street. Richard?
Yeah, I go to ResearchNet in Market Street as well for the Greenwich ResearchNet. So yeah.
We did a talk about hate crime.
Yeah, we did a talk about hate crime and a leaflet about hate crime as well. So that should be on the Oxley's website. So.
Brilliant work. Because we was talking about equal rights, same as Richard, equal rights.
Equal rights for everybody and disabled people included as well.
Yeah. Cool. Next question, Neil.
Neil's headphones not working. There you go.
Yay.
Yeah.
Oh,
How's that? Can you hear me?
Yeah.
Yeah. Okay. Great. Good. Christine, over to you.
I think friendships are so important. That's why I believe in connecting people, because I think friendships should be on an equal basis. That we shouldn't have the language of client or patient when we're talking about friendships. So for, my friends are my friends, whoever they are.
Yeah.
Whatever their abilities, whatever their color, whoever they are.
Thank you. And Lloyd?
And I'm also a dear friend of Christine's and Hayley's and Jim.
Don't tell them how many years, Lloyd.
I'm not going to Christine. Sandra, I think this is the first time we met, I think.
Me? Are you talking?
Yeah.
Yeah, I think it is.
Yeah. And I'm also a friend of Steve's.
Yeah.
And about last year, about 2 years ago, I started working with the Norfolk NHS Foundation Trust with Sue Bridges.
Oh, I know Sue Bridges. And
on
also,
the Green Light Champion team.
Yeah. And do you know Heidi McKay?
I know Heidi McKay, yeah.
Because she works with Sue. She used to work with us.
Oh my God.
Yeah, she's been back to yeah.
Oh my God.
We have a couple of people that would like to talk live as well, if that's okay. So I know we have someone called Mr. Roberts who would like to share his experience. So Mr. Roberts, we're going to come over to you. We will be able to hear you, but we will not be able to see you. So over to you.
Thank you very much. At last. Thank you very much for inviting me, guys. I've been in the meeting all day, and to be honest, it's put my tears to my eyes listening to every single one of your stories. On the behalf of C4C, which is Campaign for Change, which is a self-advocacy group as well, I know I put my name forward for the book. I'm looking forward to reading it. I just want to say a great big thank you to every single one of you for having me on board today. Especially Steve, listening to every single one of you has put tears to my eyes today. It's my first actual web bearing, obviously using with Zoom, but on the behalf, like I said, on the behalf of Campaign for Change and Achieve Together, I would like to say a huge thank you for having me, and I'm looking forward to actually seeing the book that you actually published. So I do take my hat off to every single one of you who actually made the book possible. And to be honest, I'm almost crying here because I was listening to Hayley's story years as well, and it put tears to my eyes. An easy thing to go through at the moment. I struggled, and to be honest, it's been hard. It's been, it took my words out of my mouth. Every single one of you took words right out of my mouth. And doing the polls as well, I've learned a lot about the COVID myself. To be honest, but I just want to say thank you to one of you. Every single one of you.
Thank you so much for those kind words. Thank you so much, and thanks for joining us today on your first Zoom webinar.
I'll have to go because I got training tonight. So, but looking forward to seeing the book. Just thank you very much for having me.
Thank you so much. That's really kind of you. Thank you. What a webinar for your first one. Suzanne, would like to go over to you, if that's okay. Suzanne McGeechee. No, okay, we'll try next. I think we've got Maggie.
Hi, Peter. It's Maggie and everyone.
Hi there.
Hi there. I'm glad I got involved with the book. I did a bit about my birthday lockdown. It was very interesting because I couldn't do anything for my birthday. Lloyd and Peter.
Yeah, happy birthday, Maggie.
Hiya.
Hi, Maggie.
And it's a good. I just come on to listen to you, and it's been a great afternoon. Thank you.
Oh, thank you so much, Maggie. That's so kind of you to say. Thank you. We're going to move on. We've got Melanie next. Melanie.
Hi, my name is Melanie James, and I'm a learning disability student nurse in wet and windy West Wales. I'm representing the Health Action team from Pembrokeshire, and I'd like to thank every single one of you for the contributions you've made. It's been really inclusive, and I'd particularly like to thank Richard Orett, and I think he should be telling the Prime Minister and the government what they need to be doing. It was fantastic. Thank you all very, very much.
Oh, thank you so much. It's so nice to hear from you. Thank you. We have a question from Nicola. I asked a question earlier about how we can collaborate and link with national voices. I would like to hear what people think about this. If anyone would like to address that first. Sandra?
How we can collaborate
and link up with national voices.
I mean, I think today that this is a fantastic example of that, isn't it? With the Foundation for People with Learning Disabilities joining the South Bank University, with all the different NHS trusts, with Voiceability. This digital platform is interesting how it's really bringing us all closer together, and I think it's the beginning, isn't it? I mean, we've had 244 people here today, and on Twitter and all of the other Facebook. So I think there's lots of different ways, clearly, of being able to collaborate, and perhaps emailing the foundation for disabilities and on Steve's websites and Eddie and lots of other people. I think this is a fantastic opportunity to do that.
I think that question was from Nicola Payne, who works for McIntyre. They're a wonderful organisation.
Yeah.
Yeah. I'd love to work with.
Yeah, I totally agree, Steve, and with everyone. I think, you know, it is the virtual world has its problems, and we all know those. But what it does do is it does enable some people who may find the real world a difficult environment in which to walk around, if you like, virtually and in real terms. And I think it's really important to have things like this. So we talk about COVID, there could be one on Mental Capacity Act, there could be one on the Equality Act, how to ensure things happen with and for people. But I think what today's shown is that there really is a great opportunity now to drive forward and make, you know, this is what it's like. This whole event has not been really co-production, but more of a fusion. It's really genuine thing about nothing about me without me, rather than co-production for me often feels a bit like ITV getting together with BBC and maybe throwing in Netflix at the time. They've all got their own interests and they don't often really correlate together, but they'll all just call them co-production for a while. But when it's like this, it's a fusion, it's a reality. It's people who have got genuine connections who do this a day in, day out, phone people up like Lloyd phoning Hayley and others, and looking after each other and linking together. And I think that's a great opportunity. And I agree. I think this is the start of a significant shift. Very positive. It's great.
Yes. Cool. You're right. Yeah, good to hear.
Thank you. Lots of people have asked on the back of that, you know, are you going to do this again? Will this be available to watch? And yes, it will be available to watch. I'm not sure we're doing it again anytime soon, but the recording is going to be there for you to share with colleagues and contacts and networks that weren't able to attend today. And so use that as a resource to kind of like showcase what's being done. Lindsay asked, I commission health support services for individuals and review care packages. I've had difficulty getting access to homes to review individuals, even though we wear full PPE. It's been suggested we review individual virtually. that I struggle with this, as I feel I want to see the person. How do others feel about this?
Yeah, I don't want to hog the comments, but I think from one of the things that I do a lot of is care treatment reviews for NHS England, and I talk about it in the book during these COVID times. So the care treatment reviews are people who might be struggling in the community, having some problems mentally with their mental health issues, and maybe in inpatients. Some need to get the support there. Majority of people can get it elsewhere as well, and you do it virtually. It does give you a flavour of that person and of the environment, but it is never exactly the same. But I think rather than not do anything, it is far better to do that than not do anything, if you like. It's better to do something and see the setting, see the person, but it's not the same.
Yeah, I agree. CTR, because we've been at so many CTRs together, Jim, and I really miss, we had a CTR this week and it was a virtual one, and I was able to give them the personalised information that we normally present to them. We've got so many thank yous for our personalised approach to CTRs, but yeah, I agree. It's better when it's face to face.
Yeah, you can't be eye to eye contact, can you?
Thank you. And Lloyd and then Richard. Lloyd, over to you first.
Hi, Matt. Hi, Matt. I'd like to say thank you very much for sharing the wonderful video with us.
Hey.
Thank you very much.
Yes, it was great fun.
It was
You're very welcome.
And send us a CD when you get it.
I will do, yeah. No problem, I can do that.
Thank you. Richard, you had something to say?
Let's get my address. Let's give you my address, Matt.
My nurse
visits
me, and she's in full face mask and wears the full what's it called again?
PPE.
Yeah, she wears that as well. And then every 2 weeks I go for a walk with my social worker. We started doing that this week, so
nice.
So I'm starting to go out the house again.
Oh, lovely. Thank you. And Christine, would you like to respond to it?
I'm worried when a home refuses someone to go visit in this situation, particularly, I mean, it's the same with CQC when they were denied access to highly secure units. It's not acceptable because people could be in danger. And I think a lot of organizations and Rightful Lives have campaigned against this. It's important that we, particularly those that have PPE, to have access to people so they can see what's going on and try and get a flavor of what's happening in that home. Because unfortunately, too much abuse is happening in the world, and we need to make sure that we are able to protect people. I know Pat would want to say something about do not resuscitate, and also about how we need to make sure that people are protected because they're dying unnecessarily.
Yeah, that is really true. I mean, I don't know if that doctor is going to be prosecuted, but he jolly well should be prosecuted, and he should lose his job.
That doctor who was the Oliver McGowan's doctor.
Sorry?
Was it Oliver McGowan's doctor?
No, the doctor that said people with learning disabilities do not resuscitate on people with learning disabilities files.
Right, yeah, I know they've really, CQC and I can't remember the other organisation, they're writing a report about it. But hopefully, fingers crossed, it is included in the training of all junior doctors.
And that training has got to be done by people with learning disabilities.
Yeah, exactly.
Yeah, it's good.
Can I just say one more thing? I agree with you, Christine, but we recently had a CQC inspection and they refused to come into the house.
How ridiculous.
They shouldn't refuse. I think that's the comment that Rightful Lives were making, and other families were really fighting against this stance from CQC not to inspect, because people are in danger at the best of times, and keeping families away as well. We need people, we need a regulator to be able to go in to these places to make sure that our sons and daughters are safe.
Yeah. That's what's happening, you know. It's really, really bad. They shouldn't stop people from going in and checking, because, you know, that's when abuse can happen.
Yeah. The CQC, they're concentrating on the private sector. So like the places like Horton Hall, Winterbourne View.
I want them coming to my house.
But they're concentrating their inspections now on the private sector.
No way.
They wouldn't go into your house, Lloyd.
They wouldn't. I wouldn't let them in.
We've got a couple more questions in the inbox, if that's okay.
Right.
Hayley, I have a question for you, if that's okay. What would have helped you more as a mum and daughter at home, particularly thinking there might be another lockdown?
Oh, gosh. I think, to be fair, we did have a lot of support. School were particularly amazing. We had a weekly phone call and lots of materials sent home. So I think I can't honestly say it would have been better if X, Y, and Z had happened. I think we were all in the same boat, and it was tough. No, I really can't think of anything that wasn't done well. Just on a personal level, it would have been easier if I lived nearer my family, which I don't. It's just those kind of things, isn't it, really? But no, I can't think of any active input that anybody could have done to make it easier for us.
Thank you. It's the honest answer. Thank you. We've got a live question from Sam Prowse. So Sam, we're going over to you.
Hi everyone. It was just a comment on that bit about being able to see your loved ones that have in care homes and supported livings where there's been lots of restrictions. I think equally it's important to know how people with learning disabilities feel when their loved ones have gone into care homes. So my granddad has had a massive decline in his dementia during lockdown. And mentally that's been very, very difficult. And so I've seen my granddad on a video call for about 30 seconds since the beginning of May, and it just ripped my heart, like not being able to see. And I think it's important that people realise, and that's why it's great technology in some ways, but you don't get that feeling of, does that feel like a home for my granddad? He's not asking to go home, but you know, like you can see he looks okay, and my grandma's having regular video calls, but you're not seeing his room, so you're not kind of seeing what's around. What could we do to make it more personal to him? More of a comment rather than a question, but I thought it was quite important to share.
Thank you for sharing that, Sam. And it's something that's something that I've certainly heard of. Would anyone like to comment on that? It's, you know, sure. Matthew, there you go.
Sure. Thank you very much for sharing your experience there, Sam. I just wanted to, it just reminded me of actually one of the interviews that we did as part of this publication, which was talking about the manager of a assessment and treatment unit, and his sort of major priority, as great as it is that we can make contact digitally and virtually over Zoom and Teams, his greatest priority and the thing he was most looking forward to was opening up the doors again and letting people see their families. So I think, yeah, it's definitely a message that resonates with a lot of people, and that idea of enforced separation, especially for people with learning disabilities who may not be able to understand the reasoning behind being separated. Yeah, I just think that really resonates with some of the messages of the book as well.
Thank you for sharing that. We've got time for one more live question, and Daniel, you have your hand up, so we'll come over to you. No, okay. We'll come back to Daniel if he's there. Lucy has put a comment in the Q&A box. I work to support and enable adults with a learning disability to have a voice in their care and to be fully involved in how their services work. I've struggled since COVID to work virtually with my colleagues who are experts by experience in learning disability. And I want to say a massive thank you to everyone involved in this conference and the book. It has made such an engaging and inspiring afternoon and has made me feel more positive about working virtually and supporting people in the best way possible when restrictions are in place. That sounds like a lovely kind of comment to finish on. I'd actually like to go over to all of you just to round us up before I hand over to kind of Steve and Eddie to just to close today, and I will go through one by one. Would you like to share some? Oh, sorry. Yep, Daniel. Yep, we'll come over to you.
Hello,
Hi,
Jim.
there.
Hi, Jim. Can Jim hear me? Jim.
Jim, you're on mute.
Yeah. Hi. Sorry, Daniel. I can hear you. Yeah.
I'm Buggy Buddies. Have we met?
Have we met?
I have a feeling we have. I met you at conferences, I'm sure.
You probably have, but the thing is, I can only see your name, Daniel. So I'm sorry, I can't see your face. So
yes.
Daniel does some amazing tapestries. He's an amazing, talented artist. And Peter mentioned Daniel before, so he's an amazing artist. Hi, Daniel.
I do know Daniel. Fabulous. Hello.
Hi, hi.
Hi, Daniel.
Thanks so much, Daniel. Thanks for tuning in. We're out of time for questions now, but I just wanted to go around all of our panelists just to share your last thoughts, positive words. And Lloyd, we'll start with you.
I'd like to say I will report this back to my friend Sue at the Norfolk and Suffolk NHS Foundation Trust.
Thank you, Lloyd. Matt.
Thank you very much for the opportunity to be here today. It's been a pleasure being part of this publication, and what I really hope we've managed to capture is people's stories in their own words. It's been a great experience, and thank you for the event today.
Thank you. David?
I've been really impressed by how engaged the participants have been in the webinar. Far more than a lot of other webinars I've been to. It's been really great how everybody's really engaged. And yeah, get hold of the book. There's some really fantastic stories in there. It's fantastic.
Thank you. Richard?
Oh, hello. Had trouble getting off mute. Thanks for having me. So, yeah.
Oh, thanks, Richard. Hayley?
Thanks so much for having us, Natty, Princess Elsa and I've learned so much this afternoon. It's been a range of emotions from, sort of slightly upsetting realities, should I say, to really upbeat, positive stories, and the goosebump moment with the music, Matt, and everything. It's been amazing. So thanks for having us, and it's really boosted me as a mum and a carer to be part of this online family. Thank you.
Thank you. Peter Allen?
Yeah, I just say it's been a good webinar. I enjoyed it very much. I liked everything of it.
Thank you. Pat?
Yeah, it's been great. I popped in and out because otherwise I'd get goggle-eyed. But one of the things I did like was, Matt, you have got such a wonderful smile. Keep smiling.
Thanks, Pat. Sandra?
Who would have thought 6 months ago that we could have all been connecting like this through a digital platform?
Yeah,
it's just wonderful, and I'm sure we're going to do lots of other amazing things. Thanks for the lovely, relaxing, informal, lovely afternoon, and it's been wonderful.
Thank you. Jim?
I just think it just demonstrates the brilliance of people with and without a learning disability working together. And you can have a laugh through hard times, and it doesn't mean you're joking at that times, but it's also really important just to be human and be who you are. So I think it's fabulous. It's been a wonderful afternoon. I think the tone has been perfect, humour as well as serious, you know, and it's a really important thing to do. And I think it'd be great if we do other things like this together. And I think well done to everybody, well done to South Bank, to Foundation for Learning Disabilities, and well done to Steve, Eddie, Pete for your fabulous idea, and for Oxleas for supporting it as well. So well done, everybody. It's been brilliant. And everybody that's joined has also been magnificent. So
and also so thanks to Neil, I think, for hosting us, because he's been an amazing host.
Thank you, thank you. Well, it's all about breaking that down, that virtual wall, and showing warmth through in a virtual world. And it's certainly shown that it's possible. And Christine?
Follow that, eh? Thank you very much for having me, and it's been an honor, and I'm very proud to be part of this team. I just want to pick up something in the chat, if that's okay. And our new report on digital exclusion suggests that 34% of people with learning disabilities experience digital poverty. So I agree. So if we leave with one message from today, it's pick up the phone. There's nothing wrong with the telephone, and call a couple of people that you know, particularly those with learning disabilities, and say hello. And if we can share that, forget easy read, forget all of that. If you can't reach people, they're a waste of time. So please pick up the phone and speak to people.
Thank you very much. Thank you all for joining us. Thank you for bearing with our technical difficulties. I'd like to hand over to Steve and Eddie and Peter to close.
Let's go, okay. Right, I'll start. Yeah, I just want to start off by apologising to everybody on Twitter, Facebook, Instagram, and LinkedIn for bothering you all for the last 6 months. I will calm down now, and hopefully, hopefully you'll like the book. I've read so many stories from England, Scotland, and Wales, Ireland, but also from South Africa, Malaysia, Holland, and Austria, and Canada. Yeah, so yeah, it's from 12 countries in 5 continents. Yeah, well done. Eddie?
Well, as well as thanking everybody, I'd like to go back to a point Jim made about, you know, this is not really co-production. I mean, this is fusion. It's a kind of the way we not work. It's the way we kind of live together. Yeah. And I think that to have it on such a large scale, it's more than I could have hoped for, to be honest. How everyone's come together, how everyone's shared, and
yeah, Neil.
Hi, Lloyd.
I'm going to say goodbye.
Okay, bye, Lloyd.
Bye.
Lovely to see you.
Thank you. Thank you for having me.
You're most welcome. See you tomorrow.
See you tomorrow, Steve. Bye.
Bye.
Hey.
And I mean, on that note, I'd like to leave the final word to Peter, why we're here, and who's planted that seed.
All right, thank you very much, guys. And what I like to say that I'm pleased I'm back to college now, and I'm pleased I'm with my girlfriend, and I'm pleased I'm speaking to you guys. It's lovely to be here. It's lovely to speak to you guys, and I can't wait to all us guys get back face to face and have a chat sort of thing, and spend a bit of time together. And it's been a lovely afternoon. Thank you, Christine. Thank you, Jim. Thank you, all my friends. Thank you very much.
Oh. And don't believe Steve, he'll find something else to tweet you about.
Oh, we've got 3 other projects on the back burner. So I'll give you 2 days off.
Thank you, Stephen, Peter, and Eddie.
Well done, everyone.
Have a good evening.
I will leave this open for a while, just so people can. I don't like to close an event down straight away. There's lots of amazing comments in the chat box that that are worth sticking around and reading for. So please feel free. I'll leave this going in the background. But thank you all. The recording, and for those of you that are still with us, we'll aim to get it on our YouTube LSBU YouTube channel within the next week or so. I will send out an email with the YouTube link. If any of our speakers today would like anything included, any useful links that you'd like to share with people, then please do email that across to me, and I'll make sure that that is shared in that email. So thank you very much.
Oh, Neil.
Yep.
if I put the link on my website? It will still count it as a visit to your YouTube. If you know what I'm saying.
Oh, okay. I'm not sure. I'm not sure on that, but
yeah,
we'll touch base post event.
Yeah. Cool.
Yeah.
Great. Cool. Thank you all. Please feel free to stick around and have a look through the chat box. Or
Sing
if you
to us, Matt.
Go on, Matt. You know you want to.
No, I'm afraid I can't do it without my my backing singers, unfortunately. But thank you for letting me.
If Lloyd was here, he'd be bribing you with another joke now, wouldn't he? He'd be saying, if you do it, I'll crack another joke. Then you could just say to him, no, Lloyd, you'd crack a joke anyway. So that's...
I'll definitely be using that joke, though. That's a keeper.
Yeah.
Yeah. So, just to give another Lloyd joke, what do you call a singing laptop? Adele. And if you like Lloyd's jokes, which of course we all do, he has a joke book out called Laugh with Lloyd.
Okay.
And it's a MenCap publication, and he's doing another one as well. So I
Will
feel
you put the link in the send it to Neil? Send the link to Neil so we can all get it.
Check and see if I've got a copy to hand, but yeah, he's got some great. It's got him on the front, and it's a funny book.
When we're able to meet in person, we all want signed copies.
Oh, don't! Oh, God, he'd be delighted with that, wouldn't he? He does. He does run away. The thing is, when he does his signings, though, he chats so much it takes a flipping long. You have to sort of push him on a bit and say, "Hurry up!" Because everyone's got to get a couple of jokes. You see, it's got a long queue, but there you go.
Yeah. Cool. Okay. Well, I will end it there. I will share the chat box with everyone so you can read them afterwards. Thank you. It's been a pleasure hosting. Thank you all. It's great to meet you.
Well done, everyone.
Well done. It's been brilliant.
Well done.
Enjoy.
See you soon. Bye bye.
Thank you.
Well
Goodbye.
done.